ओम शांति। Namaskar. We would like to welcome you all on the journey of AYUSH SAMRIDDHI International Webinar Series. Today, with your cooperation, mentorship, and guidance, we have been able to touch the milestone of 497th webinar. Thank you all who have supported us as guardians, speakers, resource person. Thank you. I welcome Dr. Vishnu Prasad Sharma ji, V.K. Agnihotri Sahib, Dr. Mohsin Delvi ji, and all the speakers. खुशामदीद, स्वागतम, अजहर साहब स्वागतम। आप लोगों की वजह से ये रौनक है। ये जो भी वेबिनार की एक ज्ञान गंगा बह रही है, दिस इज रियली ए ब्रेन स्टॉर्मिंग सेशंस inspiring for next generation, and we will be confident that we will not be there in the world, but these our lessons will be inspiring for all the generations for always. This is really a great miracle. Without you, it was not possible, sir. Thank you, Naman, salute. Thank you very much, sir. So without wasting much time, I would like to request Professor Vishnu Prasad Sharma ji for his welcome in blessings. You are mute, sir.
Namaskar. Good evening to everybody. Respected Professor V.K. Agnihotri, respected Dr. Rupali Borwaji, respected Pawan Kumar Sharma, distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this evening webinar on Men Care by AYUSH. Today, we have a very important subject. So I welcome all of you. In this webinar, we have eminent speaker, Dr. Pratibhaji, Department of Sri Roga and Prasuti Tantra, Amrita School of Ayurveda, Kollam. I welcome you. Next, I want to welcome Dr. Miss Bahuddin Azad, Research Officer, Scientist 3 from Aligarh. I welcome you, sir. Now I want to welcome Professor Vishnu Priya Mohanty, HOD, Gomantak Ayurved Mahavidyalaya and Research Center, Siroda. I welcome you, madam. Next, I want to welcome Professor Dr. Thulla Mohan Das, HOD, Department of Kaya Chikitsa, Ayurveda College, Coimbatore. I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this important webinar on men's care by the AYUSH. Because AYUSH give how we can keep our body healthy. So once again, I welcome all of you. Namaskar. Over to Pawanji.
Thank you very much, sir. I would like to welcome Dr. P.G. Jadar, sir. He is Vice President, Vice Principal and Dean, KLE Ayurvedic College, and Manjunath ji is Yoga Head of S. Vyas Vivekanand Yoga Sansthan, Bengaluru. Welcome both the experts. Mohsin Delvi Sahib. I would like to request Mohsin Delvi Sahib for men care. First of all, I would like to congratulate all men in the world. Whoever is seeing our event, congratulations on International Men Day. I don't know how many men days are there, but it is only the Men Day. Otherwise, we are also allowed today to celebrate our dignity, respect, and loyalty towards everybody. Thank you. And today is very unique webinar, sir. because ladies can care for men. Men cannot care for himself. So all speakers are ladies, and we would like to listen. Mohsin Saib, your valuable initial blessings.
I would have given a closing remarks on this. Men's आप ही के वेबिनार से मुझे पता चला कि आज मेंस डे है. नहीं तो विमेंस डे तो हम सुनते रहते हैं कि हाँ जी आज विमेंस डे है, मदर्स डे है, फादर्स डे है, लेकिन मेंस डे मैंने आज आप ही के वेबिनार से मुझे मालूम हुआ कि हाँ टुडे इज मेंस डे. यूनानी जैसे अभी मिसबा साहब बताएंगे, यूनानी का कंसेप्ट ही इज ऑन मोर ऑन फोकस्ड ऑन मेन रादर देन विमेन, क्योंकि ये राजा महाराजाओं का ट्रीटमेंट था ये, तो मोर फोकस वाज ऑन मेन रादर देन ऑन वुमेन. आई थिंक मिसबा साहब वुड एग्री विद मी. तो इसी वजह से ज्यादातर फोकस यूनानी का जो है इज ऑन मेन रादर देन ऑन वुमेन. ऐसा नहीं है कि अभी वी इग्नोर्ड देम, बट यस दे आर देयर. तो आई विल गिव माय कमेंट्स लेटर. Thank you.
Thank you, Mohsin Saib. Thank you very much. Now I would like to request Professor V.K. Agnihotri sir. Welcome, Agnihotri Sahib.
Thank you, Namaskar. Good evening, everybody. All the dignitaries and very distinguished guests of today's webinar. Mohsin sir धीरे से ऐसे निकल गए कि नहीं बताते हैं, सबको पता है. Important is this that we are at the 497th step. So all credit goes to Professor Pawan Sharma ji and his tireless work day and night. Now comes the point is day. Whether it is Women Day, National Day, Yoga Day, any day, but it is day. So the day is important. And today's reference, when we talk about the International Men's Day, you see, whether it is Men Day or not, men is as human, and human must have humanity, irrespective of the gender. Man has to have humanity, character, virtue first, then only he will be celebrated all over the world, here, sky, water, every ocean, everywhere. So this humanity is having man. So whether it is men, male or female, this humanity is always ought to be available to each and every person, because we men are...
We are not celebrating Humanity Day, sir, today. We are celebrating Man Day, and we should focus on that.
Sir, we have got a lot of men, and they are all given birth by the females. So we are hand and hanky. We cannot separately say that man is superpower, man is there, but this is simply because of the women. So our Men Day, we will like to have a very good information from our women's side, so that then only we will be escalated properly that what does the man means and what for the men stands. So with these words, I think that today it will be very knowledge pouring to all of us being men, but always we have to remember that we are because of them. So we are all together, and our great respect, honor to our all today's guest speakers, because they will definitely give us the proper and important information to all of us. Thank you so much. Over to Pawan Sharma ji. And you are also say be congratulated on your this global consortium which you have completed yesterday and today also. Thank you so much.
Thank you, sir. Thank you very much. So it is really means very minimum days are meant for men, sir. So today, one day out of that day. So I would like to, because fresh information comes from next generation. So next gen Dr. Pratibha ji, if teachers will speak in the first, then there will be a hedginess, a shyness in the mind of student that what should I speak after all teachers. So I have requested Dr. Pratibha to initiate the webinar as a opener batsman. Welcome, Dr. Pratibha.
Thank you,
Wish
sir.
you all the best. Welcome.
Thank you, sir. Am I audible, sir?
Yes, clear, bete. God bless you.
Okay, I'm sharing my screen.
Sure.
Is it visible?
Yes.
Is my screen visible now?
Yes, clear, bete, clear.
Okay.
Kindly proceed.
Okay. Thank you, sir. First of all, good evening and happy International Men's Day to all. My name is Dr. Pratibhaji, second year PG scholar, here to present on male infertility. So these are just the contents of my presentation, and I'd like to move through a glimpse of the clinical presentations that come to the OPD as male infertility. First, as introduction, I'd like to say that infertility is most often seen as a woman's issue, and it is them who bear the brunt of not bearing a child. And often we find that men do not come forward to express that, yeah, it's their fault too. So why is it so? So I could get an information from the research papers that like why men can only do one thing at a time and women find it difficult to even stop talking. It's because research studies shows that for males, speech and language are not critical parts of the brain. So when we go through the MRI scans, they show that they operate mainly in the left brain and have specific locations to control speech less when compared to women. That is why often florists tell during the Valentine's Day that you go and propose with a flower rather than stumbling upon with words on expressing the condition. So that's why mainly male talk less, and often the infertility and often the not only infertility, the main conditions generally are not expressed by them. So first, I'll move on to general presentations of the infertility that comes to the OPD. First is oligospermia. Oligospermia is less than 15 million spermatozoa per 1 ml of ejaculate. According to WHO criteria, generally a 12 to 16 million per ml of semen is considered as normal, and greater than 15 million per ml of semen is considered educate. So less than 15 ml is oligospermia. What can be the causes of the disease? First one is the hormonal imbalance. So generally in an oligospermic patient, the LH and the testosterone levels will be in a normal level, which is responsible for the secondary sexual characteristics. But the FSH hormone will be in an elevated condition. This can be due to a defect in the Sertoli cells and also can be due to germ cell dysplasia. And next is diseases and medicines, infections and inflammations, and also testicular cancer, and mainly anabolic steroids can induce this oligospermia. Congenital abnormalities like Klinefelter syndrome and cystic fibrosis can lead to oligospermia. And coming to the smoking and alcoholism, the smoking affects the sperms at the level of the DNA, while the increase in the alcoholism can affect at the level of hormones. That is, it can affect the gonadotrophin releasing hormone and decrease the production of it, thus leading to a testicular atrophy and leading to a decreased sperm production. Next is surgeries. Regarding the complications of the different surgeries like as inguinal hernia repair and vasectomy, oligospermia can be a result, and also poor health status is also a culprit. So what can be done in Ayurveda? So all these can be treated in the lines of Kshina Shukra conditions. That is, when we consider a Kshina Dhatu, that is Dhatu Satmik Kriya Chukta Tantrasya Asya Prayojanam is applied here. We can do a treatment like Snehana and Svedana. So in the Snehana, we can do a Mrudu and Snigdha Svedana with Kalyanaga Gruda. And as in the case of Svedana, we can do Avagaha Svedana along with the Mrudu Virechana, mainly with Gandharva Hastadi Eranda and everything. And also Vasti, which is the Prashasta Shukra Dosheshu Vasti Karma Saishyade. So we can do Mustadiyabana Vasti, Rajayabana Vasti, etc. here. And the next condition is asthenospermia, in which reduced sperm motility is the presentation. That is, greater than 30% of the sperms are immotile in them. The causes are mainly the abnormalities of the sperm flagellum, which is happening due to the pathogenesis of the DNA H2 gene mainly, and also the metabolic deficiencies at the level of the fatty acid oxidation and the glycolysis, which are essential for the sperms for the functioning. So what can be done in Ayurveda? Mainly here, the chala guna of the vata is decreased. So we have to consider the vyana vata. The main function of the vyana vata is the yoni shukra pratipadana karma. So here it is affected, and avarana of shukra dhatu occurs here. So we have to do shodhana followed by vajikarana aushathas. According to Susruta Samhita Sutra Sthana, 18th chapter, he says that Tikta Kashaya Rasas can increase Vada and it is Abrishya except Amrita, Patoli, Nagara, Pippali and Lashuna. So all these drugs in different combinations can be administered. For example, Pippali in the form of Pippalya Dhyanuvasanam and Lashuna as Rasayana, and all the others under the Kashayas and Arishta sections, we can administer them. Next is teratospermia. It is sperm morphology defects. So as you see in the left, we see a normal sperm with a oval head and a middle portion and a healthy tail. All the rest are defects. That is, taking the case of head, a small head is a defect, a big head is a defect, and having multiple heads is also a defect. Likewise, we can see the middle piece defects and tail defects also. Acrosome-less sperm is also taken as a sperm morphology. What are the causes of it? First one is the hormonal defects. That is, taking the case of the free testosterone and the bioavailable testosterone being less, it can trigger this teratospermia. Next is the raised reactive oxygen species level morphology along with the decreased antioxidant defense. And also testicular pathologies which can directly affect the germ cell lining of the testicles, and also the varicocele can be a cause. So here we move on to the concept of the Vada, where Vata is responsible for the Sharira Dhatu Vyuhana and also the Sharirasya Santhanakara. That function is affected here. So here the Vakrata, in the morphology, a Vakrata happens. And here the Vata Prakopa must be controlled. And we have to apply Vishama Dhatu Chikilsa, whose answer can be directly seen from the Vishamajwara Chikilsa of the classical text. We generally do not combine the both two, but we have to look forward to the Vishamajwara Chikilsa itself. And Pumsavana Karma can also be applied here. That is application of the Vatashunga, and also the Lakshmana Kshiya Kashayas can be applied. And we should also not forget Deva Vyapasraya Chikilsa. And some of the other conditions that can affect the quality of the sperm and the sperm parameters are increased viscosity of the semen, which is generally treated as a kaphadushti in Ayurveda. And next is the pyospermia, where pus will be present along with the semen. This can be due to an infection in the testicles or in the seminal vesicles. Here we have to follow a Deepana Pachana followed by Kritapana. We can also administer Rasayana Chikilsa like Pippali and Bhallataka Rasayana. Next one is the fructose deficiency. Fructose deficiency mainly happens due to any occlusion in the seminal vesicles or the ejaculatory ducts. So we mainly treat taking it as a sangha of the srotas. So here mainly we give sroto shodhana with Lashuna Rasayanas, and Vadanulomana line of treatment can be done. And Vrishyadrabhya administration can also be followed with Sukumara Krita and Kalyanaga Krita. Next is balanitis. Balanitis is the inflammation of the skin of the head of penis, that is glans penis. If the foreskin is also involved, it is known as balanoprosthitis. So here the person will be having redness, itchy rashes and a thick lumpy discharge, and he'll be having a painful ejaculation and painful urination also. What can be the causes? The causes can be poor hygiene, It can lead to bacterial and candidal infections, and also allergy to certain drugs, like chemicals present in certain drugs of the analgesics and sleeping pills can trigger the itchy rashes and the discharge from the penis, and it is known as fixed drug eruption. So what can be done? According to Ayurveda, the penis is the karma indriya, and here a raktadushti is also happening in the sthana. So here we generally do an amapachana with the kleda shoshana chikitsa, and shodhana is done with ruksha virejana, and along after that we'll give a rakta prasadana drugs, and as shamana chikitsa we'll give khadirarishta, gugulutiktaga krita, and everything. And also external treatments like kshalana can be applied with nalpamaradi kashaya. Next one is epididymitis. Inflammation of the epididymis, that is the coiled tube at the back of the testicle that stores and carries sperm, is known as epididymitis. So as you can see, on the left it is a healthy epididymis, and on the right it is an inflammation of the epididymis. What can be the causes? There can be a number of infections due to the bacteria, fungi, and virus that can lead to this condition, and the complications of the surgeries like vasectomy. And if you have had an improper catheterization also, you can have this disease. Prostate gland enlargement is an another cause, and also it is mainly seen in the weightlifters. Next, what can be done in Ayurveda? It is treated as ama imprishna, and shobhakna aushadhis are selected. So here mainly it is because the patient is presented with pain in the pelvis and also fevers and chills. So we can also apply Jwarahara treatment here. Next is the orchitis, or inflammation of the testicles. So left one is the healthy testicle and the right one is the inflamed one. The causes are infections, and we apply the logic of the Vrishana Shodha here, and we give Shodhahara Chikitsa here along with Amapachana and Vadanulomana. So in the second phase, Brahmana line of management can be done. Next one is priapism. So priapism is the prolonged and persistent erection of penis without sexual stimulation. It is divided in three: ischemic, non-ischemic, and suturing. So ischemic is considered as an emergency condition, while non-ischemic we can take for the Ayurveda management. We generally follow a Vatarakta line of management here, and we give most of the Kshira Kashayas and Kshira Yukta Virejana treatments. Suturing is the recurrent attack of the ischemic priapism, and we apply Kapha Avrita line of management. So since Vata and Kapha are both of the Shita Guna, we'll apply an Ushna Tikshna line of treatment here with Tikshna Virejana. Next is Peyronie's disease, connective tissue disorder involving the growth of fibrous plaques in the soft tissue of the penis is known as Peyronie's disease. So here, mainly a fibrous plaque occurs in the tunica albuginea, and mainly we refer them to emergency conditions, including surgical corrections, and the Ayurveda treatment can accelerate the recovery process. So here, a Vakrita is caused by Prakupita Vata. Here, Vatahara Aushadhis are given, and Dukshaguna Vriddhi must be managed with the Snigdha Yukta Vastis and Rajyapana Vastis. Next is sexual dysfunctions. First one is ejaculation disorders. Second one is erectile dysfunctions. Third is inhibited or hypoactive sexual desire disorder. Ejaculation disorders. First one, premature ejaculation. Second one, delayed or impaired ejaculation. Third one is retrograde ejaculation. So this is a condition where we can see in Ayurveda, Atipravritti, Sangha, and Vimarga Gamana in order. So premature ejaculation is we take it as an atipravritti, where there is an increase in chalaguna of vata, and we try to maintain it with the snigdha conditions. And delayed or impaired ejaculation is taken as the sangha, and we try to give most of the Shukradejana type of treatment here. And Brihadiphala is the drug of choice we use here. And in the retrograde ejaculation, we use the concept is taken as the Vimarga Gamana, and Udavarta line of management is given along with the Brahmana Chikilsa, that is Kukuta Mamsarasa is also advised. So overall, we give an improve in the quality of the dhatus and also try to pacify the vata here. Next one is the erectile dysfunction. Inability to attain and or maintain an erection suitable for intercourse is termed as the erectile dysfunction. So here, when I went through the case series published in the PubMed, I could understand that most of these conditions are mainly due to the involvement of the mind. So there was a case where a couple came to the OPD, and the complaint was there was erectile dysfunction for the male. And after a proper counseling, they could find that this woman never used to stop talking during the act of copulation. So what they found was that mostly men can do only one thing at a time. And when a man has an erection, he finds it difficult to speak or hear. So before sex, he finds it happy to hear from his partner. But during the time of penetration, he can only his brain only functions one thing at a time, and he finds it difficult for getting an erection. So here, aggravated Vata dosha, Dhatukshaya in general, and Shukraksha in particular occurs, and Shukravaha, Srotodushti and Mano dosha are involved, and here proper counseling should be given along with Balya and Drishya drugs, and management includes Deepana Pachana and Srotoshodhana along with the usage of Ashwagandha. Next is the hypoactive sexual desire disorders. So what can cause a low libido? This is otherwise known as low libido. Though there are different causes, as you can see in this picture, mainly the stress, relationship issues, and depression contribute it to almost 80%. So proper counseling of the patient along with Sattva Vyapasriya Chikilsa and general Balya and Vajikarana Aushadhis must be properly administered to tackle the same. And as physiological condition, just like women have menopause, men have andropause, where just like women, they find low sexual desire during that time, and also having, sorry, and also have increased mood swings, etc. So as conclusion, I'd like to say that infertility affects 15% couples globally, and males are found to be solely responsible for 20 to 30% infertility cases and contribute to 50% of cases overall. So all we need to do is to lend an ear to them and hear what they have to say, and let them express what they have to say about the conditions they are suffering from, and let's support them. So on this International Men's Day, why International Men's Day is celebrated? Because 76% of suicides are men, 85% of homeless are men, 70% of homicide victims are men, 40% of domestic abuse victims are men. Men are the majority victims of the violent crime. Men on average serve 64% longer in prison, and men on average are 3.4 times more likely to be in prison than women when both committed the same crime. Hope this session finds useful. Thank you.
Pratibha, thank you.
Thank you,
Excellent.
sir.
Pratibha, namaskar.
Thank you, sir.
Very, very comprehensive presentation.
Very comprehensive, and I am really proud of Pratibha that she has courage. Doctor should have that courage to communicate. Thank you. Thank you, Dr. Pratibha. Excellent.
Thank you, sir.
Thank you, Pavanji. Thank you. Pratibha, number one, I want to especially congratulate you for such a comprehensive presentation. You've touched on many aspects that normally missed out. And number two, you have gone into such detail And the layout of your slides were very, very, very easy to follow. Number 3,
Thank you so much.
I'm happy that you have done this mixture of Devanagari script plus the language, the English script. Now, this is very important because this is I feel this is the correct way to convey Ayurveda to
Thank you.
even newcomers. Should never compromise on the language. And I would say this must become the norm hereafter, And I don't know what motivated you to use that format, but congratulations. I hope you will stay with us. We
Yes,
will
sir.
follow up with questions, because think of what motivated you. And the other question for you, when we come back to the question and answer session,
Right.
is where
Of course,
you
sir.
did your BAMS and how you came to Kollam. So we'll keep that as
Yeah, sir.
questions for the question and answer discussion. Thank you again, Pavanji.
Thank you so much, sir.
Thank you.
Thank you very much,
Thank
sir.
you.
Thank you very much. Ayush cannot be complete without you. So Unani is the most important component of AYUSH, and we salute Unani experts also. I salute Mohsin Sahib to introduce again Misbahuddin Azhar Sahib from Aligarh. Thank you. Thank you, Azhar Sahib, for joining. Shukriya Janab. Kusamuddin, welcome. Now stage is yours, sir. Please guide us.
Thank you. Thank you. Thank you, Dr. Pavan, for giving the opportunity, and my big brother, Mr. Mohsin Sahab, respected Vishnu Prasad Sharma ji, Dr. V.K. Agnihotri ji. As the discussion in the earlier, I have today is the International Day for Men. I am audible, Dr. Pavan? Okay.
Clear, loud and clear.
Okay. Thank you. So, but I see the list of the speaker. I am very much triggered. It is a Men's Day, but the speakers mainly are from.
Because men's care can be taken by women only, sir.
Is my screen is visible to you?
Yes, you can go for slideshow to maximize the size, sir.
Okay. Today the topic is Man Care by AYUSH. It is a very vast topic. First of all, I would like to say it is a vast topic to cover up all the men's issue in a small webinar. So I will try to be complete all the aspects in this short period. The first question comes into the mind that is man care is different from the women care? This is the first question comes into our mind. Generally, we have care all the issues similar in both sexes, but some problems are only related to women for their sexual reproductive organs. Similarly, some are related to the men's. So the what problems having the women's and what the men. Today we are discussing this issue. So if we go into detail of the Unani, we can divide our talk into a 4-1. One is literature, then one is clinical problem, and third one is research and the formulation that we have to treat all the issues. So I will discuss this issue in the later on. First of all, I would like to share some issues related to the men's problem and the role of Unani medicine. We have found hundreds of research articles on man-related problem and its solution through Unani medicine in reputed and national and international journals. They cover up some common diseases are BPH or prostatic hypertrophy. And another one is in Unani terms is Zofeba, the loss of libido. Third one is premature ejaculation, or jisko in Unani it says surat inzal. Surat is says early, fast, and inzal is ejaculation. And another common disease among the Asian countries, especially in Pakistan, in India, in Bangladesh, in Srinagar, in Sri Lanka and Burma, there is health issues in younger generation of society is spermatoria, that is called Jiriyan in Unani medicine, and etc. Similarly, the Unani have old evidences of researches, but from the last 50 years in India, we are conducting a research in academics and in institutes. And I have found many theses and projects on that one that covers the problems related to the male, and they have worked on diseases, and they have started the project with a drug-oriented or a disease-oriented both. As I said earlier, this is one of the favorite topic of development of Unani regimens and dosage. It is famous for the Unani. That is, Unani comes in India. That is not for a common people. That is only for, as the Mohsin Saab says, it is only for the rich pupils, Nawabins, and the kings and the emperors of the time. So all the Hakims are totally related to them. They only touch the common people for a very small issues of that one. And we all know what the habits of our Nawabs, emperors, kings, and the landlords, and some say in that कि साहब जो हमारे कहा जाए कि साहूकार थे, या जो हमारे नवाबीन थे, या जो हमारे बड़े जागीरदार थे, उन लोगों की क्या क्या चीजें, क्या उनके शौक थे, जाहिर है उन्हीं को खुश करने के लिए ही at that moment the Hakims and the Unani physicians have developed many formulations for that one. यूनानी के ताल्लुक से अगर बात करें तो सिर्फ ये बात आती है कि साहब क्या यूनानी सिर्फ और सिर्फ सेक्सुअल डिजीज के लिए है? किसी हद तक हमारा दिमाग जब जाता है तो ये चीज समझ में आती है कि जाहिर है ये चीज सिर्फ ऐसा ही लगता है कि यूनानी ओनली डील्स विद द सेक्सुअल इश्यूज इन अ कॉमन. अगर आप बात कीजिए तो हर आदमी कहता है ओ यूनानी, अरे यार ये लोग तो सिर्फ अम्बलाइकस के नीचे की डिजीज डील करते हैं. It is a myth in the society, but it is some up to some extent it is reality. We have done a lots of experiment and develop many dosages and drugs for that one only. And Unani has a good and a rich literature on that one. Some clinical problems that the people come to in our clinics, common problems are that is hypertrophy of prostate. That is called in Unani Gudda Mazi ka badh jana. And another one is Tile Maya, that is hydrocele. It is also related to man problem. Sudate Ahlil, obstruction of urethra. Another one is testicular hypertrophy. Irtakaya Kusia, testicular atrophy. And now from that aphrodisiac and premature ejaculation and excessive desire of sex, all the issues that are totally related with that, the topic we are covering here, as my earlier speaker also discussed regarding the infertility in male. But the male have the other problems also except the infertility. So these are the conditions where the male have the problem. So the topic is that we have cured the man with AYUSH, so the man has also some other problems apart from the infertility and other issues. Another very common problem among the young generation of the society is Jaryane mani or spermatoria. And in school going and college going students, or the people of that age is also have a common problem of nocturnal emission, that is athalam in United States medicine. And some more problems are kuru hai, zakar wa khusiya, I mean ulcer in penis and testis, and hikka kazib or a pruritus of penis, and worm kazib, there is an inflammation of penis or urethritis. These are the problem for which the patient has come to our clinic, and it is a very common in the society, and everybody come, okay, Dr. Sahab, humko aisa ho raha hai. So what the Unani has it literature, and why and how the Unani physician has given the treatment, or they counsel him just for not giving the medicine, only just consult you are all right, but take care of that and you will be all right. So first and foremost, I want to discuss about the prostate disease. It is a common in the old age, above the age of 40, and people, many men, and find it's embracing to talk about the lower urinary tract symptom, that is LUTS, such as nocturia, urge of incontinence, and reduction of this urinary stream. And this is only due to the hypertrophy of the prostate. It is a physiological phenomena in a man. In later stage, it is hypertrophied and may cause some pressure on that the urethra, and that leads to strangury and the pain in the lower region, and urinary stream goes to be low, and that is a continuous problem to a man at that age if a patient is having a hypertrophy. And sometimes it may lead to a carcinosis, that we say it is a prostate malignancy. So I can say if prostate is in a malignancy, to treat it not into a Unani or in other system of medicine. I can only say for the Unani that the other system has a good treatment. So without wasting the time, you have to be consult other modalities and the system that have a good and a fast result. But in an early case, if it is not a malignant, it is only a benign, and having a problem of only just what I discussed the issues. We have treated many cases in our clinic. We have only prescribed the decoction of Z-maize, that is bhutta. Bhutte ke jo baal hote hain, we have only giving the decoction of that one, and that's cured to 70 to 80% within 2 to 3 months of treatment, and the patient is all right and having no complaint of urgency and low stream of urine and other heaviness in the lower abdominal area. So if we have many other disease, other drugs also. We have tried in this area is khare khasakot, that is triglycerides also, and we have make a combination of maize, flax, and triglycerides, and we have a good result, and I published this paper in a reported journal. So if we treat this issue of man with this simple medicine, all are available in the market, and we are giving only our decoction, and it will be a cure. Only the in allopathic or in surgery, it only the treatment is that they have operated it and give a relief to the patient, but it is a costly and then have a chances of any other complications. So we can say only if you have a benign prostatic hypertrophy, so you have to be opt decoction of maize and decoction of triglycerides. It is a very common problem among the age of 7% to men age of 40 years are suffering with these issues. Another issue of that is testicular lump. Although a testicular cancer is a rare diagnosis, about 750 men annually only. It is the most common solid cancer in man age between the 18 to 39 years. It is a risk factor including the family history, a history of undescended testis. If a patient have undescended testis, so must go for scanning and make an early diagnosis of that one. If it is any abnormality in their testicular area, so that may be a lump, and that may lead to another complication to the patient. So scan in the early stage and make a proper treatment for that one. We can cure this problem in early stage. If it is an advanced, we have go for the other options also. In this area, we can early sign of testicular tumors before an important community massage in that, and why man is swelling of to consult doctor. We have a medicine for that one that reduce the pressure on that one, and why the testicular lump have been formed. We have to avoid the pressure on that area and give a proper care of that one, so we can overcome with this problem. So now I come to what the Unani has rolling of that one, जिसके लिए यूनानी बहुत मशहूर भी है, और हम लोग कहते भी हैं कि यूनानी तो सिर्फ और सिर्फ जो है वो सेक्स के लिए ही जानी जाती है. So before I go to that disease, I want to discuss my previous slides. Unani has a great literature on that one. It is a small list of books that is totally written on that area. That is Asbab al-Nishat, written by Hakim Ibn Ramzan Beg Mazandarani. Matlabul Mubashirin. Mubashirat is a play of act. That is Mubashirin. When a man is meeting with their partner, it is Mubashirat in Arabic word. So a book is totally written on that one, how we have to be met with our partner. Matlabul Mubashirin, written by Hakim Mirza Muhammad Gilani. And another book is Ziaul Afsar fil Bah. Ziaul Afsar, Zia is Arabic word, it means for a roshni or a light. That and Afsarul Bah is how we have improved our sexual power. That gives a light on that one. A book written by Hakim Ghulam Mahmud Khan Sahab. It is a book only written on that one, how we have improved our sexual life and how we have make body strong and sexual strongly. Maslakul Marwarid. It is also another book written on Shifaul Mulk Hakim Muhammad Hassan Karshi. I think Mohsin Saab also not knowing the name of these books. क्योंकि ये मैंने वो बुक्स तलाशी हैं जो आम तौर से जो बुक्स के अंदर जो यूनानी के बुक्स लोग पढ़ते हैं, वो जो सिंपल बुक्स होती हैं, हमारी टेक्स्ट बुक्स होती हैं, उसके अलावा स्पेशली रिटन ऑन दैट वन. ये तो मैं वो बता रहा हूँ आपको जो टेक्स्ट के अलावा हमारे यहाँ स्पेशली बुक्स लिखी गई हैं जो सिर्फ और सिर्फ मेंस की उस चीज के लिए जिसके लिए यूनानी मशहूर है. कानून अज़दवाज. अज़दवाज इज अ टर्म फॉर मेल एंड फीमेल. हम कहते हैं अज़दवाज जिंदगी माली, अवर सेक्सुअल लाइफ. Qawanin, there's a law of Azdawaj, mean how a man and a woman can prolong their sexual life. It is a written book by Shifaul Mulk Hakim Muhammad Hassan Karshi. Another book is Tohfa Jahan Bazm Ishrat. Tohfa is just a gift. Jahan Bazm Ishrat. Bazm is your mahfil or your party, and Ishrat where you have make a sense of your well-being. इशरत निशात जहाँ से लिया जाए, जहाँ से आपको फरहत महसूस हो, जहाँ पे आपको खुशी महसूस हो. This is a name of the book written by Hakim Hassan Hasiq Merati. Guldasta Farhat. Guldasta, it bouquet of Farhat. The Farhat is enjoyment. So now I am elaborating the name of that one, how the Unani scholars have written all these books on that areas, and they have collected all the information regarding their act and their how we have used the formulation and how we have developed our sexual life active. that is written by Hakim Muhammad Hasik Mirati. Again, another very famous book, Mujarrabat Ibn Sina, Tuhfatul Ashiqeen. Ashiqeen is a lover. Tofa is a gift. Mujarrabat Ibn Sina, there is the Mujarrabat कहते हैं हमारे यहाँ उनको जो they are in the practice of Ibn Sina. Ibn Sina is the great scholar of Unani medicine who have written a book on that one. Tuhfatul Ashiqeen, how we have make happy our partner by which act. They have covered all the aspect and the problem related to the man and the women also. And another one is Kimya Ishrat. Kimya is a chemical and Ishrat is also a synonym of Ishrat. I know the enjoyment. So Sayyid Hakim Karam Hussain is the father of the great scholar of today's Hakim Zilur Rahman Sahab, the Padam Shri of Unani medicine. This book is written by his father. So it is only a small list of that books that is not in a text, but if anybody want to be learn regarding the issues to the male and especially for the sexual problems, they have to be gone for these books. So it is a very common problem among the men, erectile dysfunction, as my earlier speaker says. Why, what are the causes and how we have overcome with this. There's a symptom of is being identified in the majority of men, and we can say it is sometimes is related to the some other organs also. So if the patient is suffering with diabetes or or other cardiovascular diseases, there may be a chances. So the patient have erectile dysfunction. So we have correct the issues, and इसलिए कहा जाता है कि sex is not between your legs, it's between your brain. So if your brain is healthy and you have to be correct the cause, so you have overcome with this problem. This is a common problem of premature ejaculation. That is, I say earlier, it is common among the younger generation who have in a hurry, or people who have engaged with the life of with the busyness. So they have required everything is a fast. But in this, say I can say, if you are in your home, so your home is yours and your partner is yours. So don't be a hurry, and that will definitely resolve the 90% of the cases also in this by this issue of premature ejaculation. We have an experience of more than 25 years in my practice. I always say to my patients, okay, please be impatient at the time when you are meeting with your partner, so you will overcome with your issue. You didn't have any cause and any issue with your health problem. As per the Unani, if you are healthy and you have a good level of the hemoglobin in your body, so you also have a good quantity of humor in your body, and humoral theory of the Unani medicine play in great role. Even blood is also one of the component of the humor. If you have a good content or quality of your blood in your body, so you must have a good circulation, and circulation play a role for your premature ejaculation. So if a patient have a history, so we have resolved according to them some psychological issue with the premature ejaculation, to treat the patient like from the psychological aspect. If that has some issue with the physiological conditions, then only need to be some medicines for that. Another problem is libido. Libido may be excessive, and sometimes it is a lack of libido. And libido relates to a person's desire for sexual activity and sex-seeking behavior. Level of libido vary from person to person, and that I say earlier, it depends upon the health and the mental status of the patient, of a person, how it is healthy, and how much quantity of blood and other humor and the temperament that have. If the patient is in a good state of health and a good state of mind, so they must have a normal libido. If it is some issues with their health and their mental status, They have the issue of the libido. As I say, the mental status is not only for that मैं mental हूँ. That also covers some other issues also. जैसे मैं कहूँ कि अगर हम we are in a mental trouble, so that is not a mental trouble only for me also, or a person that is concerned with that one. That mental status is surrounding with the 7 things: how you are healthy, how in which environment you are living, from which type of people you are meeting with your day-to-day life, and other issues with your social status is also play an important role for your mental status. If your mental status is healthy, so you must have a normal libido. If it is some problem in your society and some issues with that one, so you have a lack of libido, and that leads to a mental status. कहते हैं कि इसकी वजह से लिबिडो होती है और लिबिडो की वजह से आदमी को मेंटल स्टेटस होता है. Sometimes it is a vice versa, that may be due to this, and this due to that one also. This is that reciprocate to both the sides. So if we discuss about the principle of treatment in Unani medicine, so treat the cause. Sometimes we need to give some mukawiyat drug, mukawiyat, just to be enhance the desire of a patient by the stimulation. We have giving the tahrik to that one. Sometimes it give to a tahrik to their mind, and sometimes it give to the tahrik to their particular organ, that one. So we have a both type of drug that enhance the brain for the sex, and sometimes we have give the drug to that particular organ to stimulate and give a good result and good stand to the body. Sometimes we need some patients have a hyperactive problem, that one. So we need to be give some sedative to that one. So we prescribe the musakkinat, that is sedatives, that also give some systemic sedatives, and sometimes we need to go to treat a patient particular organ by the local sedatives. And after we giving this sedative, there is a need of tabreed to make a skin or a mental normal. So there is a correlation with the tabreed. Tabreed is a form of treatment in Unani medicine where we have giving some correction to the if it is hyperactive, so we give the sedation. So to bring that organ to a normal specific condition, so we have giving the tabreed to the patient. Another one is mu'allid dam. If a patient is weak, so we have giving some medicine that generates a good humor, especially for blood in the body, that leads a major role for the act of that we have desired. So we have giving the hematinic drugs that called in Unani medicine, that is mu'allid dam. And sometimes the patient, the consistency of their semen is become a very thin. So we have need to be give this increase the viscosity of that semen. So we have giving the mughallize mani adviya, that is giving some higher consistency to the semen quality. So we have a list of n number of drugs. So here we have only discussed some common medicine that are available in our market, that is pambadana, that is Gossypium herbaceum, that is asgan, Withania somnifera, that is kurma, Phoenix dactyphylla, singhara, that is muesli, and salam misri, Orchis muscula, jaifal, that is a common spices in our kitchen, tudri, and Bahman Safed Centuria Bahman, Salajit, everybody know Zafran, that is Kesar or Kurkum. Some Unani scholars have developed many, a lots of number of Unani formulation, and some important formulations are Majune, Mughalliz khas, that giving the insufficiency to the semen, especially. Majune Philosophy, it is a good nervine tonic. Majune Arad Khurma, it gives strength to the body and especially for the muscles. Habbi Ikrami, that is especially for applying on the part of the male organ. Habbi Mumsik Tilai, it is also for the local application on the male organ. Majune Pambadana, it is also from Gossypium's formulation. Habbi Ambar Mumiyai and Majune Salab. And one is the most important, that is very popular among the society, that is Goli Vaizarisha. Apart from that, many others that the companies who are dealing with these issues, I could not be advertised to anyone, but say all the aspects are covered in this area that gives the strength to the brain and the body, and especially for that organ also. One code I want to share is मुश्ते नमूना अज खारवर ज़ारे. ये हमारे यहाँ कहावत होती है, मुश्त कहते हैं एक मुट्ठी को. ये मुट्ठी भर सिर्फ हमारा एक नमूना है, जो कि झोले में कितना है उसके बारे में हम नहीं कह सकते. It is only a glimpse of that one कि यूनानी have a good and a rich source of that area which we are today discussing. And last, I would like to thank Dr. Sharma and especially Dr. Mohsin Dehelvi Sahab, who gave me the opportunity to share view of mine on this platform. And also congratulate to the person who are attending this for the International Men's Day. And apart from that, we are celebrating the International Men's Day, but maximum speaker are from the female. Zahir hai kisi एक कहावत ये भी है कि हर कामयाब इंसान के पीछे एक औरत का हाथ होता है. तो मे बी वी आर गिविंग दिस टू अ मैसेज टू अ कम्युनिटी कि वी आर सक्सेस जस्ट फॉर दैट कि वी हैव फीमेल डॉक्टर्स हियर who are presenting their valuable thoughts in this area. Thank you. Thanks a lot.
शुक्रिया शुक्रिया जनाब, आपने पूरे यूनानी का दर्शन हम लोगों के सामने रखा. शुक्रिया जनाब, बहुत बहुत शुक्रिया. मोहसिन साहब, योर वैल्यूएबल कमेंट्स है.
It was a wonderful presentation. Like I said in the beginning, that Unani famous है sexual deficiency और premature ejaculations. भंडार है हमारे यूनानी. अगर हम देखा जाए तो पूरी किताब जो है वो मेन पे ही है. जैसे मैंने कहा कि वो राजा महाराजा का ही ये सिस्टम आया यहाँ इंडिया में और उन्होंने इसी पे फोकस किया. अगर हम देखें तो मोस्ट ऑफ आवर फॉर्मुलेशंस विल बी कंटेनिंग अंबर, जो आज 25 लाख रुपए किलो है. सैफरॉन है, मरवरी जिसको मोती है. कई हमारे देखेंगे कॉम्बिनेशंस इन ऑल दीज सेक्सुअल मेडिसिन्स that we'll be having a combination of amber, saffron, salab, misri. All the expensive herbs are there. Gold, basam, kushta, sona ka basam, chandi ke basam. So all these is a combination that we see, and that is why हमें थोड़ा सा एक drawback भी होता है हमारा. लोग हमसे ये कहते हैं कि भाई why is यूनानी expensive? आयुर्वेदा तो इतना महंगा नहीं है कि यूनानी की दवाइयाँ क्यों महंगी होती हैं. तो हम यही कहते हैं कि भाई हमारा जो हकीमों ने जो कंसेप्ट बनाया है वो एक्सपेंसिव ही बनाया है, बिकॉज इट वाज बेसिकली अ सिस्टम दैट वाज पैटर्नाइज्ड बाय द इन इंडिया बाय द राजाज एंड द महाराजाज. सो हर हकीम ने ये कोशिश करी कि सबसे अच्छे हर्ब्स इंग्रेडिएंट्स डाले जाएं उसमें. सो भंडार है जो किताबों की लिस्ट दी है Misbah साहब ने. Yes, I had not heard any of the names of the books, so I have taken a screenshot of that, and definitely in a day or two I'll try and procure it. अगर मुझे नहीं मिली तो मैं आपकी चोरी कर लूंगा. Thank you very much.
नहीं, असल में है क्या मोहसिन भाई के सॉरी, यूनानी की जो आम बुक्स हैं उसमें तो वो जो कुछ भी है वो तो है ही है. जाहिर है इस प्लेटफॉर्म के अंदर I do not want to share the common things. So it is a big platform. So I want to share the main khazana of Unani medicine that is only in that books. So, and especially Unani is recognized for that only the issues related we are discussing here today. And basically, क्या है कि Ayurveda is for the common people in India. बल्कि जो महाराजा थे वो भी हकीमों को अपने साथ रखा करते थे. So that's why they have prepared all the dosage form and with their choice and जो उनका मिजाज हुआ करता था कि उसके अंदर जायका होना चाहिए, उसके अंदर बदबू नहीं होनी चाहिए, उसमें एक फ्लोरिसेंस होना चाहिए. तो they have used fluorescence drugs and that makes a difference to the other people. So it is that is डिस्कस करने लगेंगे पूरी रात गुजर जाएगी. So it's my time is over. So thanks to my organizer, Dr. Pawan Kumar Sharma ji, and also Mohsin Bhai, who you give me the opportunity to share my views on that area. Thank you.
Thank you very much, Azhar Sahib. Thank you very much. जुड़ते रहिएगा, यही गुजारिश है आपसे. जब भी आपको समय मिले, आपके पसंद का टॉपिक हो, जरूर जुड़िएगा. और हर महीने मैं प्रोग्राम देता हूं 20 दिन पहले या 10 दिन पहले. प्लीज उसको जरूर यूनानी जो प्रतिभाएं हैं हमारे सामने लाएं तो बड़ी कृपा हो. शुक्रिया जनाब, बहुत बहुत शुक्रिया. नाउ आई वुड लाइक टू रिक्वेस्ट अगेन ए फायर फाइटर ब्रांड स्पीकर. मैडम नमस्कार. डॉक्टर विष्णु प्रिया मोहंती जी, हेड ऑफ द डिपार्टमेंट संहिता एंड बेसिक प्रिंसिपल फ्रॉम शिरोडा आयुर्वेदिक कॉलेज. वेलकम 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 मैडम. We are eager to listen you.
Sir, screen is visible, sir?
Yes, madam. Welcome.
Yeah. My namaste to all of you. And the topic alerted today about how we can make a balance in our society, and especially dealing with the issues or problem related to the men or the it is not the exactly the concept of sex that is biologically what is correct, but most of the times suffering or problems comes because of the the concept of gender. Means even though it's men, but their expectation in the society or presentation in the society is something in a dominant way. So many issues are related to the way how the male baby or the male child has nurtured in the family. So creating a balance in that issues, I will focus on that part only. So ऐसा एक कहावत है कि चलने वाले दोनों पैर को पता रहता है कि एक के बाद दूसरा पैर आएगा, और ना पीछे वालों को अपमान होता है, ना सामने वालों को कोई घमंड होता है. So of course my previous speaker has told about the physical issues or the diseases related to the physical body, but whatever our observation in a clinical practice, most of the times related to the social linkings and psychological emotional makeup. So when a baby come out from the mother's womb, that baby boy treated by the society or nurtured by the society with some sorts of, like I can say that's like a mental fog. So the feeling from the society is some way that as if male are having no emotions, no heart, or they have all capability of bearing powers or more bearing power than the female partners. So sometimes they fail to cope up that exactly what is within and what is outside. So that mismatching or the balance lost there when a male ever to think that what is his own capacity and what society is expecting from him. So they started to continue all sorts of responsibility, even though his inner being is not permitting. So it's like the butterfly within the cocoon. The persons also within this whole universe, and where he is trapped within and not able to bloom it fully. Therefore, the personal identity, that what is the link to the outer or the external universe, about the relationship, about the responsibility, about the job security, etc. So all the way, even though he is not able to show or demand, but within, constantly the fighting goes on. So how he can able to bury it beneath their all pain, and unfortunately, if he fell in the circumstances, then he suffered the diseases. So because that emotions, that inner buildings, inner powers are the very most, or most expensive. Therefore, it should be hidden down, or that should be buried beneath the earth. So when a male can able to bury all those powers of all those pain, and he able to just cultivate, nurtures, try to adjust, or understands that those all are temporary things, it will go away, and you will come to an application, or you will come to an contributions that hardly happens by few. So if we can able to lock within that, buried within that earth, then the tree of the male life would be good nourished. Therefore, if a person's fail there, that rigidity comes. So rigidity or resistance towards the unchanging inner beings, then the relationship breaks, or the social contributions become insufficient. So our Sangita teaches us that nana vidhani khalu sattani tani sarvani eka purusha bhavanti nacha bhavanti eka kalam ekam tu praya vrityaha. So every human being have the three variety of sattva, that is sattva, raja, and tama. Those all mental powers or the qualities, depending upon the person, that how many hours within the 24 hours day he busy with sattva guna, raja guna, or tama guna, accordingly his personality will be. So the most of the times physical body get care by this sattva, raja, and tama, and the person is responsible that how much amount of time I should be with the sattva guna, raja guna, or tama guna. Accordingly, he become sattika persons, rajasika persons, or tamasika persons. So even though by birth he is a tamasika person, but if he will able to cultivate himself, change himself. So like, we can see in the Bhagavad Gita, Arjun was completely devoted for Krishna. So whatever Krishna told, he just followed it. It means whoever able to inculcate those quality, he able to, flourish themselves. This is a changes in personality is possible. So even though he is a very tamasika person, constant practice of sattva guna, he can be a sattika person, and his all contributions can be changed. His all identity can be changed. That's why change is constant, and each individual persons, those who think that I am a male, that's why I should be very strong enough, and there should not be any emotions for any such tough decisions. So that could be again a flexible quality. So here the questions comes that some are social reformers, some are the personal reformers. So if you say Doha of Kabir, so it all made for the personal reformations. So we are thinking, we are sometimes claiming that society should be reformed. And we are thinking that one day somebody will come to change the society where we can have a good and calm life. But is it possible without the personal reformations? So his all Doha has made to understand the persons from its inner sense. So here we can see this is the Bikram and Betal. So Betal is nothing, nobody, it is our own dead body itself. So it's a symbolic presentation that we are carrying our human life by keeping our own dead body in the back, and which is controlling our all variety of contributions in or all variety of identity, either in the family, in the working place, or in the society. Therefore, each and every moment will conscious that presence of the dead body at the back, and we will be more conscious at each and every moment of our life. So this is a very complete person who is Chaitanya Mahaprabhu. He is in a very, he is from a very good, rich, cultured family, but still he left his family and he started to work on his personal reformations. Because it is the human life is constantly, a gift to us, that how we can bring changes and we can ready for the next life, for the transmigrational journey by reforming ourselves. So it is not the man, it is not the woman, it is the individual persons who is a complete human being. So that completeness, जीवन सार्थक बने, that completeness, that sense should not come at the end of the lives, at the oldest age. It should come from the beginning of the lives. That life is a gift to achieve the moksha, and by certain care is needed to the physical body, also to the emotional body, and then the physical body, the emotions or the atmic spiritual developments is much essentials to just it's not just after around 2011 this concept has come that men are suffering some issues when the society having imbalance, that women upgradations creating some problems in the society. Therefore, there should be an upgradations to the male side too. So now it's not a purpose to create imbalance in between men and women. We all ladies or the women should understand that once upon a time, Durga was the defense minister, Saraswati was the education minister. So all these ladies mass controlling, or having such powers, and now it is something else. Therefore, they are just trying to bring into the levels. But with that sense of upgradations, many ladies people taken into a wrong interpretations that we are more supreme to the male. So that imbalance is actually misunderstood and misimplemented in the society. So it's not the male or females. It's more better to understand that we are individuals, and individuals are approaches towards the ultimate happiness in human life. Now a question comes from the Samhita that this is a inside the mother's womb, the baby when landed into, is it a matruja garva? Is it a pitruja garva? It is a rasaja, atmaja, sattvaja. So sarvabhava, 6 factors are there which is leading towards the garva. So a garva is possible because of the influence of 6 factors. The 6 factors are either matruja, pitruja, atmaja, sattvaja, rasaja, or satmyaja. So these 6 impacted to a garva. It is not a lady's garva or gent's garva. It's a male baby or female baby. The landing of 6 quality will be different. So the basic ingredient, the basic formulations is same. And whatever the differentiations comes, that is when the baby coming out from the womb to the society. If we will not understand those meanings, then it is like a arthan bhagya khaya yatha. So it's financial loss is like a bhagya kshaya. Similarly, not receiving the core concept, these core values, then it will be like a wrong implementation of Shastra para health and diseases. So all the health and diseases is because we are not linking those things. So we can see here matruja bhava. So mata, or the female characteristics inherent from the mother or from the parents to the child, like the organs are tvak, rakta, mangsa, meda, nabhi, hridaya, kroma, yakrut, priha, brukha. These are the soft tissues, soft organs are highly initiated, highly influenced by the maternal side or from the maternal side. And coming to the next one, we can see here pitruja bhava. So some of the paternal characteristics that influence to either sex. It is not just the male baby will be created from the pitruja bhava, from the paternal characteristics. So the male baby also influenced both by the Matruja and Pitruja, all the 6 factors. It is not very, say, very disintegrative approach to the either Matruja or Pitruja bhava. So we can see here Kesa, Smasru, Naka, Loma, Danta, Asti, Sira, Snayu, Dhamanya, Sukra. So Sukra, by listening Sukra, we translate into sperm, and here only we do the mistakes. So Sukra here, any dhatu or tissue responsible for dhatu nirmiti, for new cell generations. It happens in both male and females. So this concept of men care doesn't have a base to think. So conceptually, if you go to the Shastra, to the Sangita, it has no differentiations actually. So that is just, we can interpret in terms of endocrinal secretions, that is just the dominancy of one particular hormone. As we know, we can identify the progesterones and estrogens. So that dominancy or testosterone, the dominancy just changes according to the time or the age group itself. Sometimes we can see in case of male, we have a dominancy of female sex hormones, or in case of female, we can have an observations of dominancy in the male hormones. So this is just, how far our emotions is busy with such variety of manasika bhava. Then proceeding towards the next bhava, that is atmaja bhava. So when the garbha landed into the womb, so that's a garbhava kranti, this variety of technical terms is given. So when the garbha avakranti are landed into the womb, that times, what are the karma and karma phala? So all those are reflected to which variety of species that garbha will land, that atma will land into. So here it is very clearly written, tasya punar atmana janma aditya. So it's before, prior to selecting that to which womb it will landed into, to which variety of species it landed into. It totally depends upon the previous karma and karma phala. And accordingly, it gets its existence. Sasatam eva sukra sunita jivanam prak sangyoga. So prak sangyoga, it is prior fixing that in which place, with which womb, with which parents that janma will take place. It is not a life of the soul. It is again has written there that any non-living, so-called non-living objects, those are also having the karma and karma phala. Why they are attached to me? Why this pain is in my hand? This pain also have a karma and karma phala. That variety of concepts are also available in Sangita. So proceeding to the next factors about the manasika sattika factors, that karana, all indriya. So here you can say nacha karana dosat. So akaranam atma So in the garbhajanana, in the landing of womb, all those characteristics from the manasika bhava, from the all indriyas are also have a greatest role in the connectivity of purva janma and iha janma, or from iha janma to the next janma. So this ichha, dvesa, sukha, dukkha, chetana, prayatna, buddhi, all are the atmika quality or adhyatmika quality landed into the adhyatma dravya, and it is everything can be wiped away, but the karma and karma phala never left to anybody else. That Shakti is the kinchit karma basat. Kinchit, no any negligible amount of karma and karma phala can be left from our life. And question the next one, here you can say Satmya jascha ayam garbha, which is just going to take birth. That is also depending upon the Satmya characteristics of the parents. So either paternal side or the maternal side, both are habituated with certain variety of emotions, with certain variety of diet. Those are also reflected to the garbha, and the baby to his own life, it is totally connected to the satmyata of the parents. Therefore, the marriage should be with a plannings, the conception should be with the plannings, because those are writing the characteristics of the upcoming baby. So this is the reasons that it is nowhere I able to get a reference. This is the way the male dominancy will be in the society. So we can dominate those characteristics. So it is totally depends upon one individual's own karma and karma phala, and the life has gifted for that purpose. And here we can say that's the concept of rasajascha ayam garbha rasaja. So whichever nutritions we are giving, if you are giving a red color waters, that soaked by the tree, and all the presentations will be like so. So here rasaja, in that sense, it is totally depends upon the psychological feelings or the physical feelings. That rasa is the basic nutritions. It nourishes the body tissues, and not only the physical body tissue, it also nourishes the sattva guna to the manasika levels. So it is actually concluded that matrujascha ayam garbha, pitrujascha ayam garbha, atmajascha ayam garbha, satmajascha ayam garbha, rasajascha astija khalu sattam opapadukam iti hovacha bhagavan atreva. So it is a conclusive remarks that either male or female baby, before coming to the society, are having the equal responses, equal regions. They are 6 in numbers. No anyone can be left. So it's a male baby, it's a female baby, have a equal regions for their sustainability, for their development. Therefore, there are some SOP I have kept here, that what should be the standard protocols to upgrade the to take a care of men specially. So because we are celebrating here Men Care Day, referring the Manusmriti, where two contrast reference we can get. Number one, Yatra Naryastu Puriyante Ramante Tatra Devata. Similarly, the same Manusmriti speech reference is that Nastrim Swatantram Arhati. So ladies should not be have a freedom. Now that way Manusmriti criticized many times. Now, if it is written that a lady should not have independency, what it indicates? That indicates a Viparya Tantriti. What is Viparya Tantriti? That a complete contrast meaning to get. Because ladies is precious. Because they are more powerful. Because the whole family is depending upon the ladies. Therefore, they should take care specially. The freedom should not be. That was the purpose. So it is the main care, and if a family having a good worship or respect, all the inclined to be respected inside the family, then definitely that family will be a happy family. And that is the first protocol to have a good man in the family itself. So gents, तभी अच्छा होगा उस फैमिली में जिस फैमिली में लेडीज को उस लेवल पर पूजा किया जाता है. Now the term dependency and independency is we little wrong or wrong way we decode the concept. Well, because they are precious for the health of the family, for the prosperity of the family, then that's why that variety of terms is available in Manusmriti. But in the same reference, same textbook, it is written कि उसको देवी जैसे पूजा किया जाए. So if it is like so, then definitely the man is also in a very good positions or good protections in that same family. Now coming to the next SOP, now what is the protocol written here? That the Sanghita itself written Aturasya Vikara Prasamane Apramada. So we should not have a pramada, doing wrongs in the treatment of diseases. That who is a male, who is a female, according to that concepts, it is every individual person is Ardhanarishwara. So nothing is female. It is here the Shakti, that power in the form of potential energy, that is the Shiva. In the form of kinetic energy or the applications, that is the Mahakali or the Shakti, represented in terms of either Durga or Kali itself. So we can see here is an image. So it was with a purpose. Mahakali has just implemented in the society, and the condensed form of energy is Shiva. So the story was like so that Kali को जब control नहीं कर पाए थे, तो then Shiva sleep on her way, और वही शक्ति condensed form में आया, and Kali realized that it's nothing to be now. No more implementation is needed. So either male or female, everybody should understand that they are complete from their birth. It is just the society to continue that strain of marriage systems, the stream of understandings in the society. That variety of things has kept. That is a man care, it's a female care, it's a woman day, it's a man day. So conceptually, it's a complete human being. And the completeness in the physical body, now we need a complete understandings and psychology. then it will be a Shiva Shakti. They are not different. They are just two variety of energy form, either potential or kinetic. So coming to the next SOP, that when Ram attack on Ravana, every times एक मुंडी काटता था, वो फिर से आके जुड़ जाता था. So Ram failed to kill Ravana. And then at the end, he realized that he can be only killed if the target will be to the naval regions. So here is a point in our Samhita, Indriya Jayo Nandananam. So unless and until we will not able to target to the center point of our emotions, that emotion is connected to each 10 head. So we are focusing to the external stimuli, that who is taking care of me, whether somebody is loving me, whether somebody is respecting me, whether I have a good platform, yes or no. So all those way I am connected more to the external things. Unless and until I'll connect to my inner beings, the inner source of powers, or that umbilicus, then all the 10 heads, 10 projections, multiple projection of sense organs cannot be controlled. So every man or female, they should understand that our core concept to target is our inner beings. And we need to upgrade those. That's why Shastra teaches us, Indriya Jayo Nandananam. If you are thinking, planning to have a happiness, first target is to centralize our all external forces, all external powers, all external relationship to the inner beings. And coming to the next ones, when we are starting to work, that how I can able to centralize my all emotions. That times everybody have inclinations to be shine like a sun, but nobody ready to burn like sun. So कुंदन वही बनेगा जो आग में तपेगा. So आग में तपने के लिए कोई ready नहीं है. Now in everywhere we can see here, these are the very big economically strong persons. Do they work for gaining money? Definitely no. They are actually building or setting a character in the society. So if I will ask a questions to a common man in the society, चलो ये बिजनेस करेंगे, पैसा अच्छा मिलेगा, वो क्या बोलते हैं, यार पैसा मुझे नहीं चाहिए, मेरे घर में अच्छा पैसा है, मुझे बिजनेस भी नहीं चाहिए, बहुत डिस्टर्ब लाइफ है. Now we are not ready to work that way. So money, we are not actually working for earning money. So when we will start to work not for the money, but to set a character in the society, to have a disciplined life, then we can realize that that purpose of inner reformations is something else. Purpose of money gaining is something else. So स्वार्थी बनो निस्वार्थी बनने के लिए, योगी बनो उपयोगी बनने के लिए, ये बहुत जरूरी है. It is most essential that how far our thought process is needed to centralize. And coming to the next ones, that we may in a very big house, but our psychological or emotional expansions is much to reform. That's why I have quoted here, a global brain awakening is very essential nowadays. हमको पैसा तो बहुत मिल गया, घर भी बहुत बड़ा मिल गया, लेकिन सोच आज still need to reform and expand. So our emotional expansions that still awaiting that how we can inculcate more and more numbers of experiences, and we can expand and we can be useful to the society. Now coming to the next ones, अगर ज्यादा मेहनत करने से like a ant हम ये सब कुछ सीख जाते थे, तो फिर हर इंसान मूंगी भी शायद, or the ants will lead the society. So it is not to just do more physical exertions. More to that, we should understand the unique selling prepositions of what are the hita to our lives. So a hita ayu can be achieved through these qualities. What are the qualities? That first point, we should be an examiner. Pariksha karna apramanasya trivarga. So trivarga, that is dharma, artha, kama, moksha. So chaturvarga mein se moksha will be kept separate, because if one will try for dharma, artha, kama, moksha will definitely achieved. So we should be a very sharp examiner for this trivarga prapti. And Trivarga Prapti is possible when we understand Parasparena Anupahatam Upaseva Manasya Ujarasam Pujakasya. So I have a symbiotic relationship to all the peoples around to me. Parasparena Anupahatam. We can see without the symbiosis, the thing cannot be established. I should understand that aham or egotva or I-ness can be a first failure door of human life. I should understand I am nothing without the other relationship. So coordinations are balanced in both the facts, that I within the we within the I. That is a biggest understandings of human life. So jnana vijnana upasamasilasya buddha upasevinam. So jnana vijnana upasamasilasya upasama or vinasa or the that is how we can make a link in between the knowledge, the power, the discriminative powers, and Buddha Sevinam, who is the expert in the subject. So we should have a respect to that all senior or experienced peoples. So those are all other quality of how one person can establish a heat of beneficial lifespan. And coming to the next points, when a baby boy born out, the family, the mother herself also started to teach that realize मर्द का कभी दर्द नहीं होता है. So that rigidity starts since from the childhood, that I will be a whole responsible person to each family members. But practically, is it possible that one individual person can take the pain of everybody else? Is it practically true to speak that one person can take all the problems of every family members? So ऐसा क्यों नहीं सोच रहे हैं कि हम हर इंसान को फैमिली में नींद से उठाएंगे? After 12 years, up to 12 years you can take care. After 12 years, even the children also should take care or treated like individual persons, and their each opinion should be treated and then as a very contributory opinions, so that those all rigid concepts, rigid mind will never permit a bigger diseases. So the male peoples suffer this variety of bigger issues because they remain rigid within. They never feel that they should have emotions. They should express those emotions. So sometimes I make a joke कि उसी लड़का के साथ लड़की का शादी कराओ जिस लड़का को पूछो कि बाबा लास्ट कौन से दिन आप रोया था, रोना चाहिए. Those emotions should be. Rather, they may be very rigid in their decisions. They may be very strong, very rude to their behaviors. So these are the small things, but have a great roles in different relationships. So if we can see in the society that multiple numbers of responsibility in the ladies' cases and the multiple responsibility in the gents' cases, the approaches are different. So immediate outbreak of the emotional fluctuations, that is hingsa variety of things, immediately expressed. They never say. So at the beginning, they always try to just reserve within, and it comes like an outbreak. So that variety of hingsa, it is not way, but they just never like themselves. I will say, be kind to yourself. If you will outbreak, you will face such variety of emotions, then there is no difference in dying and living. So if you are like to be living, then you should be flexible. So the moment when the pain is coming, you should try to resolve sharing with anybody else. If not possible, at least in front of a mirror, that sharing should be, because that will only take care. And another concept is in our Samhita that when a person becomes nastika, that every times that open mind is not. So MCD principles, the most to do, can do, or we should not do. We should discriminate those all powers. We should not always push ourselves that क्योंकि हम male है और कुछ भी उठा सकते हैं तरीका. So it should not be, because it's a tendency of patakebhya param papam. So that variety of concept has written that this whole sinful activity starts when we fail to adjust and we express ourselves that I can manage everything, and therefore we unable to, or we disconnect ourselves from the godly activities. So at the end, I like to wind up with this concept that there are three things, that is Dhaneshana, Praneshana, and Paralokeshana. So three asana are paryapti, are sufficient to reform the individual persons and to have a successful life. We can say, Bhagwan Gautam Buddha. So he was from a very rich family. So Dhaneshana was there with him, but he left everything searching of himself. So मुझे मेरे को ढूंढना, मुझे मेरे साथ रहना 24/7. If a person will learn that to live with his own inner beings, then he is only one successful human beings since from the childhood up to the end of the life. Sleeping here is also, and Gautam Buddha at last he sleep like as if he is sleeping in his mother's womb. So it is the so cool and calm. So mrityu ek ashirwad bane. Everything is in our hand, but death is not in our hand. So that what we can say, the majestic death, that's a gift of human life. So everybody's life should be successful, and we should have a majestic death. Therefore, the diversity is essential. So we need to bring those diversity and duality, because Vaishamyata is the sign of health. The Charak Samhita Sutrasthana 16th chapter, Katham Sarire Dhatunam Vaishamyata Bhavetiti. So Vaishamyata is always, is inevitable. And our aim is to approach all those Vaishamyata not with resistance, but with the flexibility. So this is my last message to in these platforms, that every human life have many such windows of pain, and buried all those pain within the earth, stand on that earth and realize that these all things are temporary, and they may comes that I will achieve my target goal, or the core goal, that is transforming myself into the next levels. Because param drushtva nivartate, without going or transforming to the next emotions, the problems of previous emotion cannot be handled. So thank you to all of you for your
Thank you, Vishnu Priya ji.
kind listening. And if any questions are query,
really, you have metamorphosized the concept. Excellent. SOP are great SOP. This should be followed by every man and woman also, to take care of each other. Thank you, Vishnu Priya ji. Thank you very much. आप पूरा अलग रंग दे देते हो. मैं वही गौर से देख रहा था कि कहाँ की बात कहाँ चली गई, और ये अंतर्मन की बात है, इसको इग्नोर नहीं किया जा सकता. You are very right on your point. These cannot be ignored, and if we follow these, thank you very much. Thank you very much. Now I would like to request Dr. Tulya Mohandas ji, HOD of Kai Chikitsa, Coimbatore. Welcome, madam. And after that, I would like to request Dr. Manjunath ji. Manjunath ji, please stay, because after Dr. Tulya Mohandas, we would like to have your blessings that how yoga can men care. So he is from
Yes, I will try to. Definitely.
Thank you, so nice.
I will try
So
to
nice.
give in short my opinion. Definitely.
Sorry.
Yeah.
Thank you, so nice. So I would like to request Professor Tulya Mohandas. Welcome. Thank you, Tulya ji, for correcting my mistakes.
It's okay, sir.
Welcome.
Sir, am I audible, sir?
Yes, clear.
So, my humble namaste to everyone. So, as a Kai Chikitsa person, I would like to focus more on the disorders of the men, which we practically seen in OPD. So, before wasting much time, I would like to go into the topic. So, these are the common health issues we see in men, like heart diseases, hypertension, alcohol abuse, lung cancer, diabetes, skin cancer, prostate cancer, BPH, and men are more prone to Parkinsonism, multiple sclerosis, Alzheimer's disease, low testosterone, Raynaud's disease, Burgess disease. So the question comes, why only men are more prone to such diseases? So like we all know that men are more prone to stroke because they are addicted to smoking. And what happens is the nicotine in the cigarette or the BD gets deposited in the blood vessels, and which causes the narrowing of the lumen of the blood vessels, which affects the blood flow to the brain, and which lands up in the, ends up in the stroke. And even the overweight and the lack of physical exercise act as the risk factors for the stroke. Now coming to the lung cancer, smoking, different types of tobacco such as pipe and cigars are adding as a triggering, triggering factor for getting the lung cancer. And those, see, it is also an occupational disorder. So those men who are more exposed to this asbestos and radon in the workplace, they will be more they will be more prone to get this lung cancer. Now coming to Burgess disease, very common, very common, which we get in our OPD and which we take care very beautifully. So the risk factors for the Burgess disease is those who are smoking, triglycerides, those who are known diabetics, elderly patients, raised BP. So these people are more prone to get Burgess disease. Now we come back to the Ayurvedic aspect, like what our Ayurveda says about men care. So in Ayurveda, we can find the following diseases which are more common in men. Like I said, just now I mentioned Burgess disease, which we can correlate with, or we can treat in the same line of Rakta Vrita Vata. BPH we can be treated on the basis of Vrishana Vriddhi. Symptomatically, when we see the symptoms, patient will have the difficulty in urine. So even the concept of Mutra Gata or Mutra Kricha can also be taken into account. Then decrease of testosterone, which can be correlated with Shukrashaya. Again, Dvajabhanga concept can also be followed. The BPH can be correlated with Vrishna Vriddhi, and it can be also correlated to Shuka Dosha, which I will be talking in the further slides. So treatment of Vrishna Vriddhi has been beautifully mentioned in Vaishyaja Ratnavali and even Sushruta Acharya, Yoga Ratnakara. So in Mataja, they have told the Kashaya made up of Shalliki, Amran, Katutumbi should be given. In Pittaja, Avagaha with Shita Jala or even Sechana with Shita Jala will do better. And Lepana is indicated with Chandana. In Kafaja type of Vrishna Vriddhi, Kashaya made of Vacha, Lavana, Shasharban, Arjuna is indicated. Kashaya made up of Varuna and Shatavari and Dashamula. Siraveda, if after doing all this treatment, if the patient doesn't get relief, Siraveda can be done. If the Vrishna is in the left side, Siraveda should be done in the right side. See, other than all this treatment, what we all usually follow is Brihatyadi Kashayam, Shiva Gudika, Neeri syrup. All this also is going to what we clinically practice. Other than that, I was just focusing on the small yogas which are told by our Lagutrais, which we can also try out in our OPD basis. Then Shuka Dosha. See, this particular Vyadi is discussed only in Vaishyaji Ratnavali, Harita Samhita, and we cannot find it in any of the Brihatrays actually. It's a Vyadi which occurs in the penis, and we can see number of ulcerations in the penis. So how we can treat that? So all the Shuka Dosha, Pittahara Kriya should be done. Pittahara Aushadhi, Siddha Grita can be used. So it can be used internally as well as even Uttravasti can be given to the individual patient. As Shodhana, Virechana, preferably Snigdha Virechana is indicated, and Rakta Mokshana also is administered. In Shasharbi type of Shuka dosha, Lekana can be done with the Shastram, then Ropane Kriya should be done with the Kashaya Rasa Pradhana Dravyas. In Kumbhika type of Shuka dosha, Rakta Mokshana should be done. In Grantida Shuka dosha, local Snehana with Nadi Sweda and Shukoshna Upanaha. Then Vriddhi. In Vantaja Vriddhi, Snigdha Virechana with air and Thailam with Shira should be taken for a month in the morning in the empty stomach. Punarnavadi Kashaya Siddha Thailam or Narayana Thailam should be administered as Basti. So it can be administered as Anuvasana Basti or Uttara Basti. Then Pittaja Vriddhi Chigilsa, Jalau Kavacharna, Lepana with Chandana, Madhukat, Padmaka and Ushira with milk. Panchavalkala Kashaya or even Panchamalakala Kalka can be boiled with milk or grita. Kafaja Vriddhi Chigilsa, internal administration of Daru Haridra Kashaya with Gomutra is recommended. Intake of Trifla or Trikattu Kashaya with Shara and Lavana. Kvata made from Patola and Patola Patra and Vasa Patra and taken with Erenda Thailam. Asnadi Kashaya should be taken with Erenda Thailam. Haritaki Prayoga, Mutra Siddha Haritaki should be made and it should be taken with Erenda Thailam and Saindhav Lavana. Trifla Kvata should be taken with Gomutra in the morning. Negrodadi Labam, the latex of the Batavriksham should be collected and should be applied as lapam on the penis. Then equal amount of Karkatiki Bijam, Trifla, Saindava with Ushna Jala. Conception of Jati Moolam and Ajak Shira reduce the Daha and Ushna Vedana. Pittaja Mutra Krichra, consume the churna of Yashtimadu, Madhuka, Midvika and Rakta Chandana with Rakta Tandula Toya. Layer made up of Vata Ankura, Sharkara and Raksha. This will do the Daha Shamana. Nirohavasti with Kashaya made up of equal amount of Trifla and Guda. And Kashaya made of Nimba, Gokshul and Cinnamon and Guda. Regular intake of Kanji and Dadima and Kashaya made up of Trifla, Ikshurasa, Sita, Guda and Saindhava. Now, as I told, as we know that when men get older, they have this less testosterone issues. So, Shukra Vriddhi Chigitsa should be done. Like take equal amount of Vidarigandha. Vidarigandha Gana Dravyas have been given more importance. So Vidarikanda, Gokshuram, Dhatri Phala, Saindava, Sita and Pippali. You should have it and have it with Godugda. Consume Dhatri, Gokshura, Pippali and Shatavari with Godugda and Greta. In empty stomach, consume Yava, Goduma, Masha, Godugda, then eat Pippali and Sharkara Churna with Dugda. It is just like what Charakacharya has mentioned in Vardhamana Pippali Rasayana. So it's like a Rasayanam concept they have told. Churna of Guduchi, Shatavari, Atma Gupta, Bala, Shalmali with Dukta can be consumed. As the aged men are more prone to heart attack, so Medha Avritta Vata or the Staulya Chikitsa can be administered. So Medha Avritta Vata Chikitsa can be administered to the people who are already obese and having more risk of getting, heart attack. So, Medhavritta Vata Chikitsa, as mentioned by our Acharyas, are Virechana and Nirohavasti. This Staulya Chikitsa also should be administered to the patient, like Guru and Apatarpanam Chikitsa. So, patient should be advised to take Guru in the sense, it should be filling in nature, but at the same time, it should not increase the Medas or Kapha dosha in an individual. Then Cheshta, different types of Vyayamam, yoga should be advised to the patient. Udvartanam and Takkararishtam is indicated, and Makshika Prayoga. So Makshika Prayoga has been given more importance in case of even Prameha Chikitsa also. Encourage the patient to include Amlaka, Kulatha, Mudga and Patola in the daily routine diet. Now, Burgess disease, which is very common in men because they are more prone to have the smoking habit. So it can be correlated with Raktavrita Vata or Uttana Vata Rakta Lakshanas. Like when we see the Raktavrita Vata Lakshanas, Tivra Ruja, Swapa, Tapa and Raga, Vivarnatva, Utta. So these are the, even when we see the when we see the extremities of the toe of the patient, these are the complaints they tell to us. Like we can see all these lakshanas, severe pain along with redness or in all inflammatory signs we can see in them. That is why we can correlate with Raktavrita Vata. And Uttana Vata Rakta Lakshana, like Tvak, Tamra, Shava, Lohita. These are all the color changes which we see. And Rakta Vata Rakta Lakshana, Shofa, Atiruk, Raktaja Vata Rakta Lakshana like Shofa, Atiruk, Toda, Tamra Varna, and Chinchimayana. Yes, these are the common symptoms they tell. Like they have that feeling, the tingling sensation or pricking sensation, what they feel, what the patient tells. In Rayson's disease also, and in Burgess disease, the Raktavrita Vata Chikitsa or Vata Rakta Chikitsa can be administered. Raktavrita Vata Chikitsa told by our acharyas are like Shita Pradeham, Virechanam. Especially they have told, even they have mentioned about Shiravasti also, and specifically they have told Tiktarasa Pradhanam Grita. With that we can give Shiravasti and it really give very good result. And Rakta Mokshana is indicated. Now next is low testosterone. So in that case, our Acharya has told many Vajikarna Aushadhis. So Vidari Gandhadi Churnam, the Dugdha. Simple, very simple, yoga. And Amlaki Churna with Grita or Madhu followed by milk. Or Atma Gupta Churnam with Dugdha Panam. Gunja Moola Churnam and Shatavari Churnam, take it in equal amount along with milk. Grita Brishta Masha should be powdered and taken with milk. Other than these are very, very, which I explained in my previous slides. These are very easily available and which we can advise the patient to do in home itself. And other than the above said yogas, what other rasaushadhis are indicated like Purna Chandra Ras, Makara Dhujar Vati, Amrita Prasha Grita, Ashwagandha Grita, Banari Gutika. Then one more concept what in our acharyas have mentioned is Dhvajabhanga. So men in the old age, they suffer from decreased testosterone and erectile dysfunction also. So in Ayurveda, treatment of Shukra Avrita Vata and Dhvajabhanga can be given. The Chikitsa of Shukra Avrita, what Acharya says is Virechanam is the best. And because by Virechanam, it is Vata Anulomanam and Pittahara also. So it really give good result. And Chikitsa of Dhvajabhanga, it is told Vajikarna Dravyas like Ashwagandha, Shatavari, Atma Gupta should be given along with milk. Ashwagandha the lehem or churnam or Shatavari Gritam can also be administered to the patient. Internal medicines like Kamadevaras also give good results. These are the patyas we can follow because we know that at the end of the day, the patient comes and they tell what are the patyas I should tell, follow. Please, doctor, please advise me. So this is very important like Shashtika Shali, Goduma, Navanidam, Dugda, Situ, and Mamsa of Kukuta and duck. Then Kharjura, Draksha, Amra, Jambu and Dadima, which is all these things are easily available in our market. Then Anuvasana Vasti with Brahmana and Vatahara Tailas like Ashwagandha Taila or Mahamasha Taila can be given to the patient. Then comes alcohol abuse. Yes, because this is again very commonly we seen in our society. So it can be correlated to Madhatyaya. So to get rid of this habit, we can give the patient mantha prepared with dadima, kharjura, mridvika, imli and amlaka. Add savarchira lavana with vyosha in the madhyam and give to the patient. Another option is mudga yusha with misri or churna made from trikatu, panchakola and deepani aushadis. Or even the plain dugda prayoga. Just give dugda instead of madhyam. Just tell the patient to take dugda, and he can to get rid of the habit. Then eladi modakam and ashtanga lavanam. So this was all about alcohol abuse. And other so many Acharka Acharya have mentioned the big chapter on Madhatyaya Chikitsa. So I have tried to concentrate on small yogas which we can tell to our patient. Then Alzheimer's disease. See, men are more, as we all know, they are the torch barrier of the family. Okay, we say that, yeah, even nowadays females are also working, but definitely they are the head of the family. They are the torch bearers. So they are more prone to get more stress. So they are more prone to get forget the things also. So that's why Alzheimer's disease are more common in them. So for them, like Smriti Nasha, which is more common in men after certain age, it can be prevented to some extent by the administration of Medhya Rasayana and regular intake of Nitya Rasayana like milk or Amlaki or Brahmi capsules, which are easily available by Himalaya, and administration of Nasyam as a Dinacharya with Brahmi Gritam or with Shankapushpi Swarasam. Then taking Brahmi Gritam internally with milk. So as a conclusion, what I would like to say, it's a vast topic, and it's not easy to complete everything in one presentation. So I just tried to compile some of the common issues which men come to our OPD level, and whatever we can do to them the earlier. So as the topic discussed is not a single entity, it's like a syndrome. So every month men suffer from different health issues. So the treatment is depending on the disease. So as we know, prevention is better than cure. And nidana parivarjanam eva chikitsa. So we should try to find out whatever may be the issues. As I again told, they also suffer from multiple sclerosis and Parkinsonism, which I have not discussed in my topic, because if it goes on, it will take a long time. So depending on the nidanam, we can give the chikitsa. So with this, I would like to end my topic. I hope I have done justice to my topic. Thank you, sir.
Definitely, Dr. Tulya, you have done the justice. You have covered everything in very humble manner. Excellent.
Thank you, sir.
Very great, madam. Now I would like to request Dr. Manjunath Gururaj ji. Welcome, Dr. Manjunath.
Namaste.
Welcome, sir. Welcome.
Just now I reached home from airport.
Excellent.
Listening to all the things. It's a wonderful session, and this platform is very beautiful platform. Integration of a holistic approach, real holistic approach is being done here, and very good justice is given to the subject from everyone, from all the fraternity of Ayurveda, Unani, and it's amazing, really. Wonderful.
AYUSH is not complete without Y also, sir. Welcome.
Yes, definitely.
You are A and Y both.
I am there for A and Y.
A and Y.
For both A and Y. So this is really amazing thing on this International Men Day. Wonderful activities are going on, and this is something amazing. Every day is a beautiful day as per God-given our beauty of this life and creation. That itself is a beautiful every day. Every day is a so beautiful day, and it is we need to definitely show our gratitude to the Lord for giving us such a platform to discuss and go into our own analysis. So this is possible in only human life. Out of 84 lakhs of species, what we say, 83,99,999 species doesn't know to do this online meeting. Is it not a wonder? Is it not a real wonder? Out of all the living entities, all the living entities, 83,99,999 species. The Shastra say that we don't know how to even count also how many species. In Kannada, I don't know how many Kannadigas are here. There is a saint in our Kannada. So Kanakadasa, he says in Yesu Kayangala Kaladu 84 laksha Jiva Rashiyannu Dati Banda E Sharir. This body has transcended all those lives. And this is what is human life, being men or women. That is amazing fact that which gives us really. There are many quotes from even yoga place, and today I want to remember one of the yoga great Acharya. I don't know how many of you know. It is the birthday of T. Krishnamacharya, one of the modern yoga revolutionist. And today is, incidentally, it is International Men Day, and yoga is the yoga Acharya, modern yoga Acharya, T. Krishnamacharya. It is his birthday. And it is really International Men Day celebration, I feel, as per the yoga. Really, when I see that as per the yoga, it is really wonderful way to celebrate even this man, modern yoga. So that's how there are many people, stalwarts like B.K. Sayangar and many other people. So T. Krishnamacharya, who hails from Karnataka, actually. So that is the tradition, and definitely we are all indebted to the community of yoga, Ayurveda, Unani, Siddha, and homeopathy for giving us, in a nutshell, the whole essence of our life. Is it not? So this is how a great man is not, is definitely, a great man is different from an eminent one. Is it not? So in that he is ready to be the servant of the society. This is how Dr. B.R. Ambedkar says. Is it not? A great man is different from an eminent one in that he is ready to be a servant of the society. This makes the man great. There are many people in this society who stand tall among everyone, and that makes, and those people, to the men who are all not afraid to be vulnerable, the men who support women in their lives, the men who fight discrimination, the men who are allies, we honor and love. This is a beautiful quotation, so many quotations about the men. And these men are really making the International Men Day, and a day to celebrate the warmth and the strength a man brings into our own life. This is what. So we are really proud to be men, and women, they are also proud to be women. There is no way, let us not, who is great, who is least, that are not at all necessary. The first step to be a good man is this. What is that? You must deeply feel the burden of the stones someone else is carrying. So beautiful way. So someone else is carrying this. So this is how most of the thing. And to end this beautiful opportunity, I would like to tell one sloka from Subhashita, which says, so that shows the amazing the way how our ancestors had the vision about the men power. So there is a shloka, Bhojyam Bhojana Shaktishcha, because we are almost discussing about male infertility and wonderfully Unani, Ayurveda, and all other solutions we try to find out. Okay, Bhojyam Bhojana Shaktishcha, Rati Shaktir Varangana, Vibhavo Dana Shaktischa, Na Alpasya Tapasa Phalam, it says. It is one of the things which is going to give us an amazing opening to our thought process. Bhojyam, खाना पकाना, ये बड़ी बात नहीं है. खाना पकाना जो है, there are more men who are going to cook a wonderful, delicious food. That is why Nalapaka we say. Nala Maharaja used to be a great cook, you know. Bhojyam, Bhojana Shaktishcha, even eating and getting digestion, it is not easy. Large quantity of food you cannot digest. Only when you have a good Agni, then only you can do. Bhojyam Bhojana Shaktishcha and Rati Shaktir Varangana. For this is what is libido, which is going to be spoken in that. So Rati Shaktir Varangana, Varangana means to be beautiful or to be handsome. Vibhava Dana Shaktishcha, Vibhava means being a wealthy, being a filthy rich. So it is not easy thing. दान शक्तिश्च है, तो आपके पास कुछ दूसरों को हाथ उठा के देने का जो गुण है ना, ये इतना आसानी से नहीं आएगा. ये सब चीज जो है ना अल्पस्य तपसा फलम, ये अल्प तपस्या का फल नहीं है. थैंक यू पवन जी, थैंक यू वेरी मच फॉर गिविंग दिस अपॉर्चुनिटी. इट इज एन अमेजिंग थिंग.
थैंक यू मंजुनाथ जी, जुड़ते रहिएगा, बहुत अच्छा प्लेटफॉर्म है.
ये कैसे मतलब महीने में एक बार होता है या कब होता है ये
डेली होता है सर.
अरे बाप रे, डेली
497 number is there within 2.5 years.
This is amazing.
Day after tomorrow is stomach cancer awareness day. So Ayush for stomach cancer. Topic will be stomach cancer. So we are celebrating every day with Ayush.
Wonderful. All personalities. Thank you, sir. Namaste.
Now I would like to request Dr. Madan Thangvelu sir from Cambridge, UK. Welcome, sir.
Namaste, Madan ji.
Manjunath ji, namaskar.
How are you, sir?
What a powerful event today, Pawan ji.
Yes.
Some clarity from our first Pratibha, first speaker, and then it flew all the way through to Vishnupriya ji, and thanks to our Unani speakers, and now to top it off, Manjunath ji. And Tulia ji from Coimbatore. This is a very important event that we are celebrating today. And earlier this morning, I had a message from Jaipur, Manjunath ji.
Oh, is it that?
And studying this, I will share this screen here because it's the fate of our human species, you know. And this is the title of a paper. And before I show that paper, let me just give you the background to this paper.
Okay.
It says, research shows a significant sperm count decline globally. And it shows studies across Latin America, Asia, etc., that men are experiencing sperm count decline due to our modern environment and lifestyle. And this is a very worrying information. And the paper that is being cited is this one. Again, I will just put this up for a few seconds so that people can see what this journal is. It's from the Oxford Academic and Human Reproduction Update. And you will see how the research has been done by looking at data from many different parts of the world between 2017 and 2022. And you will see this amazing, frightening information how sperm count is going down. And this is, I'm taking a slightly different perspective to what was offered today by our speakers, that there is a bigger environmental connection with our lifestyle, environmental pollution, and so many other aspects. Now, when I look at it a little further, I can see where the problem is. This is an early paper from the University of Maryland School of Medicine, where researchers find that air pollution can decrease sperm count via brain inflammation. Now, I highlight this because there may be some interventions that are very simple, like Nasya, and there are some Nasya Dravyas that might help reduce this brain inflammation. This paper goes on to show what are the neurons that are involved in this pathology. So there is a sequence of links from what we call the chain of causality is becoming clear. And there are many interventions that we talked about today, interventions that are described in Ayurveda, interventions described in Unani, and yoga. We mentioned a little bit, Siddha people have some things, and naturopathy also has certain things. But there is a way in which we can bring this all together. And there are many other aspects. When we look at Ayurvedic interventions, then we find that there may be a connection between the gut microflora and the activities in the brain. And this is one example showing gut microbiota restore central neuropeptide deficits. So there are interactions that are becoming very clear, and there are many interactions that have been described in Ayurveda and in the Unani systems, and in yoga, particularly many pranayama procedures or simple neti, jalneti can be intervention that can have huge benefits for the community at large. So with those few words, I just want to highlight the contemporary significance of the AYUSH system and how this is helping. This might help us in some of the big challenges, not only for mankind, not only for men, but also for all of mankind. You know, this is a big worry. The same issues might sometimes be noticed in female infertility also. So Pavanji, I want to thank you for bringing us all together today. I know you had a late start today, 9 o'clock, and I was happy to note that we had a lot of people joining us today, very late. I want to thank Pratibha. Thank you for your wonderful presentation. Azharji from Aligarh, thank you so much. Vishnupriyaji, thank you for giving us new perspectives on the mind and how the mind becomes a very important weapon for understanding. And finally, Thuliaji. Before I finish, Pavanji, just one last screen share. And this is just to show the importance of the Unani system. And not many people venture out to see how intricate the Unani network is across our AYUSH community. We have the Indian Journal of Unani Medicine, and we have, just like the Ayurveda systems, and we also have this valuable Central Council for Research in Unani Medicine. I hope in our interactions as we go along, we will engage more with the Central Council for Research in Unani Medicine, because I see many similarities between the Ayurveda CCRAS, and particularly important is this institution network that I just want to highlight. If you look at the institution network of CCRUM, you will see a large number of institutions, may not be as extensive as the 40 research institutions that come under the Central Council for Research in Ayurveda Science, but you can see how extremely well organized they are. Headquarters in Delhi, and then the clinical research units, the regional research centers, and specialty clinics, etc., etc. So these are areas I hope as we progress with these webinars, we will get more interaction with the scientists, researchers, and staff at this large collection of network, the institutional network of CCRU. And with those words, Pavanji, I want to congratulate once again all of us who took part in today's event, and also, most of all, yourself, Pavanji, for your continued effort. I have just come back from travels. I feel tired, but when I look at your energy and to bring us to the 497th webinar, I can only sit and congratulate you, but also listen to what our wonderful speakers have brought. Azhar ji, Azhar Saab, namaskar.
Namaskar.
अब इस साल अलीगढ़ में या अगले साल अलीगढ़ में centenary celebrations है ना जी, 100 years of Unani education in Aligarh, as far as I remember correctly.
No, basically in Aligarh, the college started in 1927.
27, actually. So what we want to see आपकी तरफ से जी थोड़ा और हमारी platform में थोड़ा और ले आइए जी. We are learning so much from your आज की जो आपने किताबों की नाम जो लिया, इतनी कमाल की किताब है जी. Or we need to learn more about these things.
Dr. Madan, it is a very short list of the books. Unani have a tremendous and lots of books in this area. All the physicians have written notebooks, mujarrabat, the matab, the nuskhas, and this is a short list of the book they have on that particular area only.
Azhar ji, इसमें हमें सीखना कि this interfacing कैसे हो सकती है आयुर्वेद और सिद्धा और यूनानी की, how we can bring it all together. I just leave that with you, Azhar ji. I have put my contact details here on the web chat, and I would like very much to stay in touch and learn more from yourself and all the other scholars.
It's my pleasure, sir. It's my pleasure, sir.
It will be lovely to learn, because there are many treatments and some strengths in Unani that will add to showing the world about the richness of Indian systems of medicine. And now, ab Jamnagar mein jo aaya Global Center for Traditional Medicine, and within that, India has taken on a big responsibility, and there is an opportunity for projecting all our strengths in there. I have put my contact details in the chat box, Azharji. Please do share yours, or I will take it from Pavanji. And
every contact number is with me, sir.
And finally, I want to thank Motionji for being so accommodative and bringing so many people to our platform. I'm also in touch with Yunus Munshiji.
Pleasure.
Motionji, thank you for bringing so many wonderful people to us, and I hope you will encourage many more.
My pleasure. Yes, I am trying my best. Yes.
To come to our platform, because we are all scholars. We are curious, and we want to learn more. I am constantly in constant dialogue with Yunus Munshiji, and he's a busy man because he is directing 2 institutes, 2 locations now. But I'm sure with help from all of you, we'll be able to learn a little more. Thank you, Pavanji. It is very late in India.
Thank you very much, sir. Thank you very much. On 25th, our 500th webinar will be there. So I would like to request Madan sir to show the caliber by inviting big dignitaries only. We will be planning 6 vice chancellors, 5 directors, all NCISM board presidents. We are trying to invite minister also. If you can invite your ambassador of UK also, we would like to welcome. But this is our 500 webinar, and we want your blessing in huge quantity, not as a silent viewer, sir, as you are facing traveling both from last 3 months. We are observing your continuous absence, which I feel lack of blessings from your side, which must not be there. You are our guardian, and please contribute for 500. I would like to see our senior guardians how would like to contribute, because now we would like to invite dignitaries, top-notch dignitaries. By inviting them, our message can be communicated to their whole institute, organization, association, whatever it may be. Now we have reached to 500, but unable to collect or accumulate 500 audience. 500 webinar we have done, but unable to invite or welcome 500 audience. Please, on that day particularly, minimum 100 should be there. I don't know how, I don't know why, but guardians' responsibility is there, and please contribute. Please, everybody, I am requesting who is senior to our platform, please contribute, and we would like to see the contribution of every senior person. Mohsin Sahib have assured us to invite minister also and to invite international dignitaries of Unani also. So Madan sir से मेरी पर्सनल रिक्वेस्ट है कि मदन सर अब 3-4 महीने से बड़े नाराज चल रहे हैं लगता है. वो आते जरूर हैं लेकिन अजनबी की तरह. तो अजनबी नहीं है आप मेरे लिए, आप मेरे गार्जियन हैं. ये अजनबियत छोड़िए, ये गैरपना छोड़िए और मुझे कंट्रीब्यूशन.
Pawan ji, we have reached.
आप किसको करना चाहते हैं? यूके से, कनाडा से, sir, let me complete. Because I am waiting for 25th, 500. I am not complaining to anybody, but I would do the role of every senior person in every webinar, sir. I have just supported you, sir. I have just facilitated, but your blessings, all seniors' blessing, I am humbly requesting कि कोई ना कोई 3-4 ऐसे बड़े धमाके होने चाहिए 500 की वेबिनार में कि हम लोग बहुत बड़े. मैं तो चाहता हूं कि आप प्रिंस चार्ल्स थे, उनको होया, और उनके यहाँ कोई भी हैं अभी जो ऋषि सुनक को बुलाइए तो मुझे बहुत अच्छा लगे. मैं तो ये कहना चाहता हूँ, मैं उस लेवल तक जाना चाहता हूँ सर. हमारे मिनिस्टर 130 करोड़ के मिनिस्टर हैं, आपके मिनिस्टर 8 करोड़ के मिनिस्टर. तो सर आप लंदन में.
I'm listening to your point. Your points are very clear. Pawanji, we have reached the 500 webinar. Number one, that is a big achievement. Number two, to increase our audience, it is a big challenge.
We will discuss later on, sir. After 500, we will discuss on to increase the audience. Today is focused point. Who dignitary will be invited for our 500 webinar?
Pawanji,
by you, sir.
It is a catch. It is a catch that we have, that we have done webinars, but what will make people come to our platform? Today we have seen.
That will be secondary, sir. We will think after 500 webinars. Every planning cannot be done within one day. I want to know which international dignitary will join us today on the 20th.
Pawanji, I want to share.
Kindly focus on that only, particular that only.
Pawanji, I want to share a couplet of a shair in Urdu.
Yes, please.
पीछे मत देख न शामिल हो गुनाहगारों में, पीछे मत देख न शामिल हो गुनाहगारों में, सामने देख के तेरी मंजिल है तारों में.
क्या बात, क्या बात.
Another one couplet for you. मैं अकेला ही चला था जाने पे मंजिल मगर लोग साथ आते गए, कारवा बनता गया. ये मजरू सुल्तानपुरी का बहुत मशहूर शेर है.
जी.
इंशाल्लाह we will reach our goal.
जी सर, जी शुक्रिया. अरे आपके मुंह में घी शक्कर साहब, आपके मुंह में घी शक्कर वाकई में. मैं मदन सर मेरे इतने इंटरनेशनल डिग्निटरी है ना सर, ये चाहे तो 25 तारीख को ऋषि सुनक को बुला सकते हैं. दिस कैपेसिटी ही हैज इन लंदन. सो आई एम जस्ट प्रोवोकिंग देयर थॉट्स. बिल्कुल नथिंग एल्स. आई एम डूइंग नथिंग. आई लाइक जम्बो.
Madan ji, Dr. Yunus is my senior, and I am working with CCRUM from last 17 years. Earlier, I was in headquarters and in planning. Now, I'm from last 7 years. I am in clinical research. Basically, my area of research is nephrology. But as far as the Unani is concerned, I am dealing with a common patient also. And I have written a book on my clinical observation in the name of Mu'alajati Mushahidat. This is a word of Arabic that I have covered 23 clinical research cases in that area that I've already published in the different journals. But that book in Urdu, now I am translating it into Hindi and English also. Most probably shortly we will be launched in a 2 form, that book.
Congratulations. All the best.
Thank you. Thank you.
Congratulations.
इसमें अजहर साहब यहाँ पे डिस्कशन चल रहा है कि
500 तारीख 500 वेबिनार
कि लंदन में
11:30 बज रहे हैं सर.
जी सर.
11:30 बज रहे हैं. इसीलिए केवल मेरा, मैं अर्जुन जैसा नहीं देखता और एक आंख नहीं देखता तो मेरा कभी निशाना पूरा नहीं होता सर. प्लीज सपोर्ट मी इन माय मिशन. प्लीज सपोर्ट मी. हम्बली रिक्वेस्ट.
Sir, audience to पढ़ जाएंगे. We have to share this. If we share this link to different platforms, they have some WhatsApp groups. So the people have to come to join that one. It is not a hard task to be collect 100 people at that 100th episode. You will share. If you share me, then I will share in a different groups of the WhatsApp. Definitely, the people will join your platform at that day.
Azharji,
just see, we are organizing 499th webinar on 24th, as I will be in the flight on 23rd. And on 24th, one day is there, Netherlands Day. Everybody knows. I am circulating program 10 days before in starting of month. So, but I am not receiving response from UK to support. So kindly, Madan sir, ये 499 भी तो मैंने डिजाइन बना लिया. 500 के डिजाइन में आपकी मदद की जरूरत है. हम गिनी बुक के वेरिफिकेशन के लिए भी अटके हुए हैं. उसका भी मैंने मेल भेजा है. हम उसको प्रॉम्प्टनेस से करें, क्योंकि एक मेल का जवाब देने में 1 दिन लगता है सर. मैं सुबह से शाम तक 150 मेल करता हूँ. तो आपसे हम्बल रिक्वेस्ट है, आपके आशीर्वाद में कमी जो आ गई है उसको पूरा कीजिए. देवता से आशीर्वाद मांगते हैं. अब मैं क्या कहूं, यदि वो देवता, ट्रेवल आपसे ज्यादा मैं कर रहा हूं सर. आपकी छोटी छोटी सी कंट्री है, मेरे यहाँ की स्टेट से भी छोटी छोटी कंट्री है. तो मैं ट्रेवल आपसे बहुत ज्यादा कर रहा हूँ, कंटिन्यूअस कर रहा हूँ. सुबह 3 बजे से रात 11, 11:30 तक लगा हूँ. इससे ज्यादा और मुझसे क्या चाहते हैं? कृपा करें, कृपा करें, कृपा करें. देव ऋषि सुनक को ले आए इस मीटिंग में तो आपकी जय हो, जय हो, जय हो. अरे ऋषि सुनक नहीं आए, आपके पार्लियामेंट्री सेक्रेटरी आ जाए, आपका एम्बेसडर आ जाए, कोई नीदरलैंड से ये 2-3 लोग आए तो नीदरलैंड डे है 24 को. मैं 499 में ही इन्वॉल्व कर लूंगा, या अपनी 501 को अपन सेलिब्रेट करेंगे. लेकिन सर मतलब आपके आशीर्वाद में कमी ना आए सर. आपके आशीर्वाद, एब्सेंस को तो हम टॉलरेट कर पा रहे हैं सर जैसे तैसे, लेकिन आपकी कृपा में कमी आ रही है वो समझ में नहीं है. हाँ, तो वो एब्सेंस तो टॉलरेट हो जा रही, जबकि आपकी तो ड्यूटी है कि आप कैसे भी जुड़े, हर समय जुड़े, हर रोज जुड़े. हमको ऐसी ऊर्जा मिलती है आपसे कि पवन शर्मा डबल हो जाता है, यूं समझिए. दिस इज माय हम्बल.
पवन जी,
500 पे फोकस करके 5 दिन है अभी, केवल 500 पे फोकस करें. और 5 दिन में यदि 5 डिग्निटरी भी इंटरनेशनल स्टैंडर्ड की आपके द्वारा आएंगी तो हमें संतोष हो. जो लगेगा कि सर ने कंट्रीब्यूट किया 500 भी. रियली दुखी हूं सर, मैं बहुत दुखी होकर ये बात बोल रहा हूं.
This is the, Pavanji, ये जो चल रहा काम, this is the slow progress to success, Pavanji. It is a systematic approach of reaching our goal. अब देखो हमारे साथ है यूनानी
लेकिन
वाले सारे।
सेलिब्रेशन तो होंगे ना, स्लो में सेलिब्रेशन नहीं होता सर। दिवाली में धमाके किए जाते हैं, स्लो में सेलिब्रेशन नहीं होता, स्लो में मूवमेंट होता है, स्लो में गाड़ी चलती है। ये हमारा 500वां सेलिब्रेशन है। अब उसको किस नजर से आप देखते हैं, मैं भी समझना चाहता हूँ।
ये देखो जी, हमारे साथ पढ़े किताब संहिताएं 5000 साल से अभी भी नहीं पहुंचा कहीं। अब अभिसेना की किताब है जी, दिस वाज द मेजर टेक्स्ट बुक ऑफ मेडिसिन पूरा यूरोप में।
ये सब अपन बाद में बातें कर लेंगे सर। अभी आप बताइए 5 आदमी कौन से ला रहे हैं आप और कहां से ला रहे हैं? स्ट्रेट फॉरवर्ड आई वुड लाइक टू आस्क नेम, हम्बली रिक्वेस्टिंग, क्योंकि मेरा दिमाग और कुछ काम ही नहीं कर रहा। मैं अरेंज कर रहा हूँ वेबिनार, ठीक है, लेकिन 500 भी वेबिनार किस तरह से ग्रैंड हो और किस तरह से हर राष्ट्राध्यक्ष, मैं आपसे एक रिक्वेस्ट कर रहा हूं कि एवरी हेड ऑफ द कंट्री should know about our webinar series. Please help me, sir. Please help.
I wish.
If any agency is there, we can communicate through them.
I wish, Pavanji. Let us continue on our march. Let me contact.
That is separate issue. That is separate. I am continuing. Where am I being lacking, sir? लेकिन जब मजा जब नहीं आता कि 100 मीटर की रेस दौड़ा और उसके बाद भी मेडल नहीं। Yeah, every 100 meter, every 100 webinar, I am requesting this. So this is my 100-meter race. I am doing very fast. And in the end of the race, after winning also, if I will not be awarded, this is my humble sadness. I don't know. What should I say? No words with me. 100 मीटर की दौड़ रहा हूं सर। हर 2 महीने में 3 महीने में अपन 100 पूरी कर रहे हैं सर। अगले साल हमारी हो सकता है कि 1000 हम अगले साल पूरी कर लें 365 दिन में। आप आशीर्वाद तो दीजिए, और वो भी बीच में समय निकाल के। सर आप जानते हैं मैं नौकरी कर रहा हूँ, सीआरओ के काम कर रहा हूँ, कैलकाटा का बिजनेस संभाल रहा हूँ, तो मदन सर से ऐसे आशीर्वाद की जरूरत है कि मदन सर एक तो रोज जुड़े, क्योंकि जुड़ना एक साइड का काम है, और दूसरा मेरे को 5 डिग्निटरी दें सर, पंच पांडव फ्रॉम इंटरनेशनल स्टैंडर्ड, मे बी एम्बेसडर, maybe head of the country of a small country, Ghana, smallest country head. We are ready to welcome them also, sir. But now please give me award of my 100-meter race. I'm alone racing, alone running. It is very unfortunate. Because I am trying to invite ministers right from 300 webinars. We have resource person like Delvi Sahib, Vishnu Prasad Sharma ji from Assam, but I am failed. So it is my humble request at this midnight, sir, that if senior persons will not contribute, sir, how my inspiration will be there? Please guide, sir. 100 की दौड़ के बाद बोलता हूं मैं, जो भी बोलता हूं मैं 100 दौड़ लेता हूं, पहले 100 वेबिनार कर लेता हूं, उसके बाद सर सभी से भीख मांगता हूं कि प्लीज गाइड मी हाउ टू। सेमिनारें चलती रहेंगी, वो अलग बात है, सेमिनारें चलती रहेंगी, लेकिन वो डिग्निटरी कहाँ है जिनको हम खोज रहे हैं, वो चाहिए। हेड ऑफ द कंट्री, एम्बेसडर और पार्लियामेंट्री स्पीकर, ओनली 3 कैटेगरी ऑफ dignitaries I want. This is my humble request. Small country, Kuwait, Qatar, छोटा कंट्री, एक गांव जैसा कंट्री भी होगा तो चलेगा, लेकिन that will be head of the country. It will be reputation of your platform, sir. This platform is yours, sir. Really, क्योंकि this is 500. This is not a miracle, or this is not this. Without you, it was not possible, and that kripa is lacking. Right from 3 months, I am observing that kripa is absolutely lacking. This is my humble request. Again, क्योंकि मैं केवल 500 भी वेबिनार देख पा रहा हूं, मेरी 499 का डिजाइन बन चुका है. What should I do now? 51 speakers will be there. 5 from Siddha, 5 from Unani, 5 from Yoga, 5 from industry, NCISM, all board presidents, all directors, all drug controllers, senior most, and 6 vice chancellors. I have arranged, sir. I have requested them. But I need your international contribution, sir, because this opportunity will not come again and again, sir. We will be traveling them after every 100, not only that, every 100. So please give me energy for 100. And please reply for Guinea book also, because 10 minutes letter cannot take 10 days. Hari Om, sir. Hari Om, sir. Hari Om, sir. Thank you. Thank you very much to all.
जी बहुत बहुत वहां तो 12 तो बज ही गया क्या 12 की नजदीक
जी सर, मैं मेरे 12 बज गए ना सर, मेरे 500 की दिख रही है, इसलिए मेरे 12 बजे पड़े हैं सर। क्या क्षमा चाहता हूँ आप गार्जियन, मेरे 12 बज गए सर। मेरे को 500 का डिजाइन दिख रहा है कि मैं 500 पे कौन सी ऐसी डिग्निटरी हो जिनको देख के विश्व अपने आयुष के पीछे, बस ये चाहता। आप वो तुलसी भाई को भी बुला लेंगे तो मुझे बड़ी खुशी होगी। हमारे मोदी जी के तुलसी भाई, वो है ना WHO के हेड जो है तुलसी भाई। मोदी जी हैज गिवन नेम ऑफ तुलसी भाई।
let us discuss this offline, जी थोड़ा सा।
वो तो आप सोचोगे फिर तो वो 10 दिन निकल जाएंगे सर, जैसे एक लेटर में 3 महीने निकल रहे हैं।
ये 25 को
10 दिन निकल जाएंगे तो वो मेरी 500 भी रह जाएगी, 550 भी आ जाएगी अपने सोचते सोचते। आप मेरे को अभी फोन करोगे आप तो 5 आदमी इकट्ठा कर लोगे, ये मेरे को कॉन्फिडेंस है सर। आप पे बहुत कॉन्फिडेंस है सर मुझे। आप 5 फोन करेंगे, 10 फोन करेंगे तो 5 आ जाएंगे। यू आर ए डिग्निटरी सर, यू आर ए डिग्निटरी, रियली डिग्निटरी एंड आवर गाइड सर। बट अनफॉर्चुनेटली वी आर lacking to have your blessing from so many days. This is our pain, sir. This is my pain. Don't take it away. This is my pain.
The other point, Pawanji, is to increase audience. आज तो थे काफी
वो अपन 500 के बाद सोच ले कि अभी नहीं सोच पा रहा सर मैं, क्योंकि मुझे 500 का है, मैं अर्जुन की तरह आगे बढ़ रहा हूँ सर। नेक्स्ट के यदि यही सोचता तो ऑडियंस अभी तक आ जाती सर। ऑडियंस क्यों नहीं आ रही वो अब मैं कारण बताता हूँ सर। ऑडियंस क्यों नहीं आ रही?
मोशन जी
मैं
भी
बता नहीं, आई एम गिविंग यू द रीजन सर व्हाई ऑडियंस इज नॉट अटेंडिंग फ्रॉम 6 to 9. Generally students time is of wandering here and there or going to canteen and taking lunch. So we have shifted our time to 9. Now what should be done? Please tell me. Because we can't invite every day every person. So students are really, they are based on the recommendations of their teacher and head of the departments. So I would like to request all head of the department, Dr. Tullia is with us, Dr. Mahesh Sharma ji was with us, Mohansen Sahib is us. They can influence person. That is not our duty, sir. We are creating best content out of the world.
पवन जी, आप मार्केटिंग का गुरु और हमसे पूछ रहे कि मार्केटिंग कैसे करें इसका।
नहीं, मैं मार्केटिंग नहीं बोल रहा हूँ सर। मैं मार्केटिंग नहीं, आपके कंट्रीब्यूशन की बात कर रहा हूँ। मैं मार्केटिंग की बात ही नहीं कर रहा। मैंने कहीं अभी तक आपको ऑडियंस की बात नहीं की। ऑडियंस में टीचरों से बात करूंगा। दिस इज नॉट आवर ड्यूटी सर। यू एंड मी आर हियर टू गेट बेस्ट रिसोर्स पर्सन्स एंड टू क्रिएट बेस्ट कंटेंट, नथिंग एल्स। कोई है वही जो राम रचि राखा, कोकर तर्क बड़ा वही सर। तो मैं क्या कहूं सर, जो हम लोग बेस्ट कंटेंट देंगे, आज नहीं कल दुनिया हमारे पीछे आएगी सर, ये बिल्कुल निश्चिंत रहिए। आज भी हम लोगों की एक स्टैंडर्ड बन गया है सर, लेकिन वो स्टैंडर्ड को अपग्रेड कैसे करना है, नाउ दिस इज द पॉइंट एंड वी शुड डिस्कस ऑन फोकस। दिस इज माय हम्बल रिक्वेस्ट अगेन एंड अगेन, बिकॉज आई एम नॉट एबल टू थिंक बियॉन्ड 500। मोहसिन साहब से भी मैं रिक्वेस्ट किया हूं अभी आपके पहले, जब आप ज्वाइन नहीं हुए थे, कि मोहसिन साहब हमको यूनानी के इंटरनेशनल डिग्निटरीज, और यूनानी के भी 15 पीस होंगे तो हमें कोई मतलब वो नहीं, कमी नहीं है सर। 5-5, 7-7 मिनट सब ब्लेसिंग्स देंगे हमको, क्योंकि यहाँ देखा मैंने 7 मिनट भी बहुत होते हैं सर। हम इधर उधर की बातें न करके 7 मिनट फोकस्ड उनसे हम लेंगे राय। तो मोहसिन साहब से भी आग्रह किया है मैंने कि मोहसिन साहब अपने को दिल्ली में बैठे हैं, दिल्ली के उनके कनेक्शंस अच्छे हैं, CCRUM के डायरेक्टर, मिनिस्टर, इन सबको मैं मतलब मैं अनुरोध करता हूं। मोहसिन साहब, आपकी ओपिनियन। यू आर म्यूट सर, मोहसिन साहब।
नहीं, definitely I'll speak to the DG CCRUM advisor Yunani, Ministry of Ayush, and also the secretary. We'll try and get in touch with the minister also. So just give, I'll tell them just 2-3 minutes blessing message. That's it. And if not possible, then I can even request the minister to give us a recording of his message.
Excellent, sir. Excellent. Great. Great.
That
This
I
is
can
what we want, sir.
So that I'll speak to his secretary in the morning, and then we'll try and do that.
Thank you, thank you, thank you. बस काश आपके जैसी भावना मदन सर में आ जाए, तो मदन सर तो सुबह ऋषि सुनक को फोन कर रहे हैं।
आपने आज मदन जी की बहुत क्लास ले ली है, आई थिंक।
नहीं, मैं अरे बाप रे बाप, मैं कान पकड़ के अभी क्लास नहीं है सर, ये बड़े भाई से छोटे भाई की भीख मांगना है। प्रॉब्लम क्या होती है सर, दर्द में जब पेशेंट चिल्लाता है तो उसको डॉक्टर गलत समझता है।
ये तो रोज की बात है जी। मोहसिन जी, ये तो रोज की बात है।
सर गायब हो जाना है सर, मेरा दुख ये है कि 3 महीने से सर गायब है। सर का रोज फ्लायर पे फोटो है, लेकिन सर गायब है। ये बड़ा दुख है मुझे,
लेकिन
मुझे आशा ही नहीं थी कि सर गायब हो जाएंगे।
मैंने जब भी ज्वाइन किया है, मदन जी वाज ऑलवेज देयर।
हाँ, तो वो आप भी इतने ही कम आते हैं, मेरे को समझ में आ गया। आप भी उतना ही कम आते हैं सर, प्लीज ज्वाइन। एक मोबाइल एक्स्ट्रा मेरे लिए रख लीजिए सर, साइड में चला के रख लीजिए, कुछ न कुछ काम की बात है। सॉरी, मैंने कोई क्लास नहीं दी। मैं तो वही बात है ना सर, पेशेंट दर्द में तड़पता है तो डॉक्टर और नर्स समझते हैं कि ये साला बदमाशी कर रहा है, तो आई एम नॉट डूइंग एनी बदमाशी। इट इज माय पेन सर, इट इज माय पेन। थैंक यू वेरी मच सर।
ओके, गुड नाइट।
पवन जी, मोहसिन जी, शुभ रात्रि, गुड नाइट जी, गुड नाइट।
गुड नाइट सर।
थैंक यू सर।
नमस्कार, गुड नाइट।
गुड नाइट सर।
गुड नाइट तुलिया, वेरी हैप्पी।
गुड नाइट।
एंजॉय
तुलिया जी, अपने कॉलेज के स्टूडेंट्स को जोड़िए प्लीज।
हाँ,
अच्छी
डेफिनेटली सर, नेक्स्ट टाइम।
नहीं, आपके हिसाब से क्या टाइम होना चाहिए स्टूडेंट्स के लिए?
से 9 बजे बराबर है सर।
अच्छा।
मैं आधा घंटे से मैं नींद में हूँ।
तुलिया जी, द प्रॉब्लम इज 9 बजे मतलब 12 बजे तक चलेगा प्रोग्राम। ये तो ठीक है कि नहीं? ये देखो पवन जी ठीक है कि नहीं?
तो इट्स बेटर सर, तो 7 बजे ठीक है शायद, तो 10 बजे तक ही चलेगा ना।
अच्छा, अब पवन जी बताएंगे।
वो 7 बजे से स्टूडेंट आपके नहीं जुड़ेंगे ना, गड़बड़ तो ये मैडम।
अरे हमारे सारे स्टूडेंट है ना, हॉस्टल में रहते हैं सर, जुड़ जाएंगे वो।
अच्छा,
अरे जय हो आपकी, जय हो जय हो जय हो। ऐसी हिम्मत से बोलने वाली मेरी बहनें ही तो चाहिए। जय हो मातृशक्ति।
मैं जुड़वाऊंगी ना उनको।
थैंक यू वेरी मच।
ओके सर।
आई सैल्यूट योर कॉन्फिडेंस, सैल्यूट योर।
आपकी कृपा है सर।
थैंक यू। नहीं, भोलेनाथ की कृपा है जी। ये आदरणीय मदन सर मेरे गार्जियन है, और मेरे गार्जियन गायब हो जाते हैं तो बेटा तरसता है, बच्चा तरसता है।
तुलिया जी,
sir, I don't know whether you remember me, like I
do very well.
Yeah, yes.
Tulia, what we are saying, Pavanji is saying, we are coming up to the 500th webinar.
Yes, sir.
We need a little bit of transformation in our approach.
Yes, sir.
And we want guidance from you, Tulia. Today, your presentation was excellent because you gave us something that the students can learn from. Treatments are very important, treatment procedures. So we want to use that kind of transition from what Pavanji has taken us up to the 500 and some innovative steps where there is continuing education,
Okay.
This is the future of all medical education. This kind of platform is the future. Tulia, I am sitting here in England. You are sitting in Coimbatore. Pavanji is sitting in Madhya Pradesh, and we are communicating. And we had people joining from Aligarh, people joining from Kerala, from Kollam, and people joining from New Delhi. And this is the future of the way we are going to take medical education, continuing education for the future. So we want you to guide us in this process, Tulia.
Yes,
Pavanji's emphasis to bring the thought leaders into this and the political backing into this, it will happen. It will happen. You know, that is because everybody is realizing.
आप लोग कहेंगे सर तो मैं 1000 का जूम का अकाउंट परचेज कर लूंगा. 1000 स्टूडेंट यदि रोज जुड़ने लगे तो अपना एम सक्सेस हो गया सर. I am ready to purchase Zoom's license for 1000 also. Everybody will cooperate.
पवन जी वहां तक पहुंचवानी है हमें, मगर सोच ये है कि क्या दे लोगों को so that they feel like...
सर नाम कुछ नहीं चाहिए लोगों को सर. आमिर खान के और शाहरुख खान के बंगले के सामने भीड़ खड़ी हो जाती है जिस दिन उसका बर्थडे होता है. वो उसको भीड़ को क्या मिलता है सर? और उल्टा चॉकलेट लेके जाती है. शाहरुख खान के चौकीदार खाते हैं, शाहरुख खान नहीं खाता उन चॉकलेट्स को. ऐसी चॉकलेट चाहिए मुझे सर कि मैं आयुर्वेद के बच्चों में बांट पाऊं. सीनियर्स दें, बच्चों में बांटूं, मेरा जीवन सफल हो जाए सर. और आदमी की भीड़ आती है सर डिग्निटरी के पीछे. कोई भी डिग्निटरी आएगी. हमारे यहाँ मार्केटिंग में एक कहावत है कि यदि कोई सीनियर डॉक्टर प्रोडक्ट लिखने लगता है तो उसके पेन को देख के नीचे के जूनियर डॉक्टर अपने आप प्रिस्क्राइब करने लगते हैं उस प्रोडक्ट को. तो आज इतने सीनियर माने 2500. आई एम रियली satisfied with the progress under your guidance that we have been able to make our resource person 2500 speakers, dignitary speakers, but the followers are not there. Dignitary are there with us. कृष्ण है हमारे साथ, कृष्ण की सेना नहीं. जिस दिन आ जाएगी उस दिन जय हो जाएगी सर. आपकी जय हो.
पवन जी थोड़ा सोच लगाओ, आप तो है मार्केटिंग का आदमी, इस तरफ
अभी आज नहीं लगाऊंगा सर, मैं 500 के बाद लगाऊंगा सर. आज मैं बेकार में 12 बजे डिस्कस कर रहा हूँ ये सोच लगाने के लिए. नींद आ रही है मेरे को ठूंस के सर. मेरा बिल्कुल सुबह उठना भी.
चलो जी, आपके बाद तो वी आर एग्रीइंग कंप्लीटली कि कुछ करनी है. वी विल डू दैट.
5 डिग्निटरी सोच लीजिए. एग्री वगैरह तो बाद में कर लेंगे सर, अपन दोनों भाई बात करते रहेंगे. 5 डिग्निटरी आप कौन सी ला रहे हैं इस वेबिनार में जो अभी तक अपने प्लेटफॉर्म पर नहीं आई? बस दिस इज माय हम्बल रिक्वेस्ट. थैंक यू वेरी मच. थैंक यू मोहिता फॉर सपोर्टिंग. थैंक यू वेरी मच.
Thank you. Good night.
Good night.